Dr. Deepthi, I'm very curious to understand, as a parent, what are the red flags that I need to be very aware of during these first 5 years, that is the golden window for a child's best start?
Common things that are said are, we thought speech will come naturally, we can wait. Boys are the ones who are usually late talkers. In our family, there were some late talkers. The child is otherwise active. Motor-wise, he doesn't have any problem. So we thought there should not be any problem. And we thought once he goes to kindergarten, things will settle down.
Can you explain the FRAT test? Really well spoken about these days. And how is it genuinely helping neurodivergent kids?
They have a normal hearing, but they are not able to respond to the name call. Not interacting with them. Lacking eye contact.
There was a child who was actually autistic. Pre-marital test done for your compatibility for a child. But at least it gives you a direction. Do you agree with that, Dr. Lokesh?
First 1,000 days of life, they say the child has to listen up to 10,000 words, spoken words with emotion every day.
10,000 per day.
Per day.
Wow.
It takes a village to raise a child.
Yeah.
And it's a spectrum.
There is no single pinpoint test. It is something that is multifactorial.
A lot of times the in-laws blame the mother. She is the reason why this child is born like this.
Where if you give a good dosage of folinic acid, they dramatically respond. 2 consecutively born is extremely rare.
Terror, horror, hope. And not despair.
Some children might have some language, some children might not have any language at all.
When we talk about autism, they are like, is this the cause? We don't know what the cause is.
If you are so anxious, because anxiety itself can cause a lot of other things in the pregnancy. Even if we tell that the percentage is only 10% catchment rate, many patients are like, please do it. Even if it is 1%, do it.
Lot of people have lot of clashes during pregnancy because of which the mother gets stressed out. This again will impact. Parenthood is so much still focused on only the mother, only the women taking all these calls.
Before the diagnosis of the first child, they already have a second child in India because the gap is hardly 2 years. A scientist could have autism. Elon Musk has autism.
In some cases, they also want to get another bahu.
Nothing is going to happen to your child.
Father also has to prepare how to handle his wife during pregnancy. Previous child has autism. Now I want a genetic test to rule it out.
500, 600 families I see.
As simple as possible, with no prior understanding, please define autism. Pause traditional parenthood for a moment. For young India today, one child, a pet, or even plants are becoming family. As conventional family structures evolve, young Indians are redefining what parenthood means. Choosing intentional, deeply meaningful ways to nurture, love, and belong. Across online communities such as Reddit, One Child India or Only Child conversations are alive, with stories of this shift reflecting a generation seeking fulfillment, balance, and connection on its own terms. However, with this evolving idea of parenthood comes an intensified focus on the child. When families choose to have one or at most 2 children, expectations rise sharply. Parents and grandparents pour their hopes, dreams, and aspirations into that child, often unconsciously expecting perfection, a prodigy, a high achiever, a picture-perfect future. But alongside these expectations lie real and important questions about biology, genetics, environment, and the possibility that a child may be born with or develop a neurodevelopmental condition or neurodivergence. This is not a conversation driven by fear, but by awareness, preparedness, and compassion. In today's conclave, we will explore how can we plan parenthood more consciously and responsibly. What steps can be taken to support a healthier pregnancy and reduce the risk to neurodevelopmental issues? What early red flags should parents be mindful of as their child grows? And how can parents emotionally and practically navigate the journey if their child lies on the spectrum? At Mr. Yoda, where India is reimagining health, we believe that conversations around well-being must be honest, accessible, and uncomplicated. We bring you stories that matter to you, to me, and to every Indian household, because health should empower and not overwhelm. Through this special series of conclaves, I, Aditi Ohori, co-founder of Mr. Yoda, invite you to engage with stories of health that help us to live healthier, fitter, and longer lives. Starting with the most important role many of us will ever play, being a parent. We are privileged to have a panel of distinguished medical experts who will help us unpack today's important and timely topic. First, Dr. Amita Indersen, one of India's leading fetal medicine specialists, currently heads Yoda Fetal Medicine and Genomics in Hyderabad. Dr. Amita and I have known each other for over 2 years, and with every conversation, I am reminded of how critical it is for women who choose motherhood to have access to skilled fetal medicine practitioners throughout their journey. We also have with us Dr. Lokesh Lingappa, Consultant Chief and Adolescent Neurologist at Rainbow Children's Hospital, Banjara Hills, and one of the most respected names in pediatric neurology in the country today. In my recent interactions with him, we spoke extensively about emerging post-COVID developmental concerns, one of which we will be addressing today: autism and neurodevelopmental challenges. Representing the world of therapy and early intervention, we are honored to welcome Dr. Madhavi Adimulam, one of the leading figures in child developmental centers in India. A true firebrand in her field, Dr. Madhavi has conducted extensive and intensive research and devoted her life to building a more inclusive society for our neurodivergent rock stars. Joining us as well is Dr. Sita Garimella, founder of Boon IVF and Fertility Center. Dr. Sita brings with her an illustrious career marked by exceptional clinical expertise and a truly holistic approach to fertility care. Through our many discussions, we have explored how an increasing number of couples are choosing IVF and how this shift is fundamentally changing the dynamics and planning of parenthood. Finally, we have Dr. Deepthi Raju, a pediatrician and one of the earliest adopters of Mr. Yoda's FRAT and Autism panel. Dr. Deepthi brings rich clinical experience and will be sharing real-world examples of children who have shown significant improvement through the thoughtful integration of biomedical support, early intervention, and personalized genetic insights. Together, this panel brings science, experience, empathy, and lived reality into conversation, making today's dialogue not just informative, but truly transformative.
तू धूप है छम से बिखर, तू है नदी ओ बेखबर, बह चल कहीं उड़ चल कहीं, दिल खुश जहां तेरी तो मंजिल है वही. Every child is a light and they shine in their own unique way. As an ecosystem in their journey, we are only here to give them the brightest possible start. We'll start with you, Dr. Deepthi. In your experience, what is the golden window for a child's best start for development?
Hi. So, if it's like after birth, what you mean by the golden window, it is the first 5 years of life, and especially the first 2 years of life, because in the first 2 years, the brain is going to increase by almost 90% by volume. It is completing its 90% of the growth by then, but that doesn't mean that it will stop growing further in form of functioning. So synaptic connections will keep occurring throughout the life, but before 5 years, if you can catch any child with any kind of these disorders, whether they are structural or functional, with the right kind of early intervention, the outcome is going to be much better.
Dr. Deepthi, I'm very curious to understand, as a parent, what are the red flags that I need to be very aware of during these first 5 years that is the golden window for a child's best start, that you would recommend every parent to take care of?
Okay, so grossly to divide, there are like 4 kinds of milestones in the kids. Most parents are majorly concerned about the motor milestones. When did the child sit? When did the child roll? If not, they come to us immediately without much of a problem, because by 1 year they know the child has to walk. They might wait 2 more years, but they'll definitely come by then. But speech and socio-personal and cognitive milestones are something many parents do not have clear-cut awareness. So the 5 most common reasons which we hear from parents when we ask, like, why was it delayed till the point of like he's 3.5, that you have never approached a doctor? The common things that are said are, we thought speech will come naturally, we can wait. Boys are the ones who are usually late talkers. In our family, there were some late talkers. The child is otherwise active. Motor-wise, he doesn't have any problem. So we thought there should not be any problem. And we thought once he goes to kindergarten, things will settle down. So most common reasons they tell us are these. But for that, the parent need to have an awareness, like what are the milestones the child need to achieve in speech and socio-personal areas by the time they are even 1.5 years. Actually, it is a prime responsibility of the pediatrician, because they would be coming for vaccinations. Every 2-3 months, they would be coming for vaccinations. But in a busy OPDs, in India especially, we don't note all the milestones. But nowadays, things are changing for the better, and we are having small milestone tracker charts kind of thing. So as early as 18 months, if we see that the child is not responding to name call, not having a good eye contact, he is not saying few words, and major milestones like pointing, non-verbal gesturing is not coming, then we are alerting the parents, and then they will follow subsequently.
Okay.
Aditi, here I would actually like to add that we probably should be pushing the time frame not just from birth. There is a concept called the first 1,000 days of life.
Yeah.
So that first 1,000 days it starts from conception.
Sure.
So right from conception, including the first 2 to 3 years of life. So whatever programming is happening to this young brain, it is starting right from the cellular level. So we start from the even probably preconceptional. And so everything that makes an impact at that point is going to, grow with the baby and is going to manifest later. So I think we should kind of look at it completely as a holistic thing, starting from preconception and all the way through childhood.
Yeah, true. I think
Right.
first 1,000 days of life, they say the child has to listen up to 10,000 words, spoken words with emotion every day.
10,000 per
10
day.
Per day.
Wow.
So even if you half it,
Huh.
that is the amount of stimulation a child's brain requires. There is an African proverb which says, it takes a village to raise a child.
Yes.
That means that only parents and just that home cannot make a child into a complete individual.
Yeah.
So much of people of different background, different language, emotions, that's what makes a healthy brain, and
Yeah.
the synaptic connections, which is lost in this era where both the parents are working, or even only father is working 12 hours, 10 hours. There is only mom at home. Whom is she going to talk to? How is that language is going to come? So those are the things which we need to look into in this one. In fact, we propose probably all married couples should be counseled at the time of marriage. If you are planning a baby, this is the thing you need to have. Have an ecosystem wherein they are able to listen to this number of words with emotions. All this environment you are able to provide, then you can go ahead and have a baby.
Yeah, a very interesting point, I think, Dr. Lokesh, you said, where I think a lot of couples these days, on an average, I see that the marriage age has now become about a 30, average people who are getting married. Now, with that comes the whole case of neurodevelopmental delays, right? Dr. Lokesh, this is for you now. I would want to ask, as a parent, and as possible, as simple as possible, with no prior understanding, please define autism to me.
Yeah, so a child who is usually responds to name call, they have a normal hearing, but they are not able to respond to the name call. Okay, it is called auditory agnosia in technical terms. Means that if the child is besides you, you are calling him 10 times, he may respond once to that. So with the normal hearing, that is one clear criteria. So that aspect is where the social responsiveness is reduced. Mainly they don't interact with the children, other children. So even if they try to, if there are children around, they have what is called as a parallel play. This group of children are playing one side, this child is just parallelly playing, not interacting with them. lacking eye contact, the interactive, responsive, reciprocative social smile. I look at you and smile. The child is avoiding your gaze.
Sure.
So these are some of the things which are prominently seen in these children with autism, apart from the language.
Sure.
Expressive language is only one component of it, but these social cues and other things are the more important aspects of autism, and it's a spectrum. Some children might have some language, some children might not have any language at all. So it's a very varied spectrum. I think Madam can add a little
Yeah,
bit
in
more.
fact,
I'm itching to say something.
Yes,
I want
yes,
you to
please.
complete
Yeah,
that.
yeah.
Actually, what happens is a lot of parents, when they see children, they end up, a lot of young children nowadays, they end up in front of screens because both mother and father are working, especially COVID and post-COVID we have seen.
Yeah.
Continuous exposure of 8 to 10 hours of screen time, and the children are learning everything by heart, whatever they watch on YouTube, could be rhymes, whatever. So, and they're just singing continuously those rhymes. So parents are thinking those rhymes are speech. Okay, and speech is always a two-way process. It cannot be a one-way process. And speech primarily also involves understanding. When the child is not able to speak, say below 1.5 years, if the child is not able to follow simple instructions given by the mother after 6 months, no eye contact, not turning the neck and looking at the mother when the mother is trying to communicate with the child, all these are signs of speech delay for us. Parents are thinking speech delay is not speaking. No, lot of our children can speak technically, but they don't have the understanding. So understanding delay is also speech delay.
Okay.
And another thing that our kids do are, they learn sentences by heart. If you say open the door, they learn open the door, and every time mother says open the door, the action followed is opening the door. So they say open the door. So mother says, my son understands open the door, close the door, get your plate, get your bottle. That's not enough. He's just learning the action followed by the phrase, and they're learning it by heart. So they don't have the understanding of the nuances of the language. When you see typically developing children, the number of words they understand by the time they are 2 is thousands of words that they speak. And they speak multiple languages spoken at home. On an average, Indian families speak 2 to 3 languages at home. And they understand these 3 languages. So when there's no understanding, there is no speech. That's what I want to say. So think about understanding when you talk about speech in young children.
Or we can even put it like this, that when the mother or parents come with there is a speech or language delay, we say that what you're talking is expressive delay. But what happens to his receptive component? That is much more important. And then we take them back and ask all these questions. Does he follow your instruction and all those? And then when he's faltering on all those things, then they understand that this is not a simple speech delay, which we are thinking like it just outgrows with age and all. Second is, we tell them there are something called pre-verbal milestones, which have to be met for a child to be receptive to language. Most important is joint attention. When somebody is saying something, you are looking at them and looking at the object, again looking at them back. This loop is very much needed for you to receive language. And then apart from that, sitting tolerance, pointing, gestures, imaginary play, at least few of these have to be there in place, pre-verbal milestones, before the child starts expressing.
Got it.
One more important thing to add to what doctor said is that a lot of children are watching screens and eating.
Yeah.
They're being fed food.
Yeah.
And a lot of children are not even learning chewing.
Yeah.
They're not eating with others. Like when I was eating, I was sitting, invariably every single meal during my childhood was like this.
Yeah.
Sitting,
Yes.
all of us sat together and ate. There was no question of not eating as a family. There was no TV, thankfully, when I was growing up. No TV also. That would mean I would watch my amma ma, my nana ma, my tata, everybody eating, and they would offer me different textures of foods. Even though sometimes my mother would say she doesn't like, my grandmother would say, no, let her try, no, let her at least lick it, smell it. They would literally, how Indian, for us, feeding is very important in India. That doesn't happen nowadays. The child sits alone in front of a screen while a nanny or a mother is just feeding. Nowadays, mothers are working. I'm for mothers working. I worked all through my life during every phase of my life. I'm not against it. But what mothers do is they have 10 minutes to feed children.
Yeah.
So if you put a screen, the feeding happens in 10 minutes time.
Yeah.
Okay. And in that 10 minutes, they have to feed. So they put a screen, fadafat khila do. the child doesn't know how to chew. If the child is not chewing, they are making soft food and feeding the child. I have had children who come to me at 6 years where the food is put in a mixer, made into a paste, and literally fed like a baby food to a 6-year-old.
Yeah.
The child doesn't know how to move the jaw, how to move the tongue. From the time the child sees the food to the child swallows the food, there are 40 steps involved. The child does it in 2 steps if you don't teach them how to do that. I mean, you can't teach them how to move the tongue, but there are so many steps that happen. When you don't chew, the child cannot speak. No matter how much speech therapy you do, the child is not going to speak. The child needs motor control to speak, and speech is a motor function, and people forget that. So if my child is not chewing, he can't speak because his jaw is not in his control. The breath is not in his control. So speech is a very complex phenomenon. We are oversimplifying it to speech therapy. Speech therapy is not equal to speech.
Got it.
They're not going to speak. Yeah.
Got it. I think I'll kind of come to you, Dr. Lokesh. And I'm also doing this because he has time paucity. So we would want to shoot him, kind of initially. And like we're doing, we can all chime in between. So Dr. Lokesh, can you explain the FRAT test, which is like really well spoken about these days? And how is it genuinely helping neurodivergent kids?
Yeah. So FRAT test is one of the testings among the hundreds of tests which have been proposed in management of autism. And this is the only condition where there are more than 1,000 therapies offered.
Wow. 1,000.
You can probably more or less. That explains our uncertainty about what is causing it.
Yeah.
And what actually helps these children.
Yeah.
Exactly. So that is where this is one of those tests which have come on recently. So where you are looking at antibodies against a folate receptors.
Sure.
So folic acid is required for the lot of enzymatic activities in the brain.
Yeah.
For normal functioning.
Yeah.
So it has to be transported across the blood-brain barrier. So if there are antibodies against these receptors, your folic acid, which is normally there in the diet, cannot be transported across. Then it causes deficiency.
Okay.
So that in turn can cause neurological deficits. There is a genetic form of cerebral folate deficiency, which actually is a very severe condition where they have ataxia, they have epilepsy, and also speech delay. Where if you give a good dosage of folinic acid, they dramatically respond. That's a genetic form. But what we are talking today is about antibodies which can be seen in population.
Yeah.
So it is seen slightly in a higher percentage in the children with autism as compared to typically developing children.
Okay. I have this simple question for Dr. Sita now. Dr. Sita, I remember when I was pregnant, I was by default given a folic acid and iron as supplements, After I understood about the FRAT and the autism, and of course, all of us, once everybody is getting married at 30 and now conceiving at about 32 or 35, or even, kind of ahead of, in their age graphs. What is your one take around, when somebody comes to you for an IVF, how do they sort of, get into FRAT? And is there a FRAT test that you recommend for basically taking the right medication before, there is a conception done for a lady?
Yeah, so your question has 2 aspects. So first is which couples do we recommend FRAT test? So couples who have had a history of babies affected with neural tube defects or recurrent miscarriages, and even elderly couples, males whose age is more than 40. So because they will be at an increased risk of having a baby with autism. So we generally recommend FRAT test for them so that we can correct that at least 3 months prior to their conception. And the second thing is, I would advise couples, if they are conceiving after the age of 30, then it's better they take folic acid at least 3 months prior to prevent any neural tube defects in the baby.
Okay.
Here, Aditi, I would like to add, when we are talking about folic acid, basically, like how Dr. Lokesh mentioned the blood-brain barrier, there is a placental barrier whenever there is any pregnancy. So we want the folic acid to get transported across this placental barrier so that it reaches the baby, basically. So the folic acid receptor is what helps in the transport of the folic acid and the the various steps that happen in the metabolism. So again, when we're talking about pregnancies, the first implantation and the formation of the, the cellular level, the placenta, the folic acid is very, very, very important there. And this affects both the conception, it influences early miscarriages and, the further development of the baby, risk of neural tube defects, all of that. But another thing is, when you have women who have had miscarriages, or some women who have had what is called as biochemical pregnancies, that is, they don't even see the pregnancy sac, they just have an implantation and then the pregnancy fails. So when that pregnancy fails, some of these folic acid receptors are exposed to the maternal blood and the mother mounts an antibody response. Now, when she gets pregnant again the next time around, which might be a normal healthy pregnancy, the mother's body starts rejecting or starts creating antibodies against the folic acid receptors. So now this group of patients form another category where they might have had pregnancy failures, or they might have pregnancy failures which they are not aware of, but still they, have recurrent pregnancy losses. So I think we need to be very selective and we need to look at patients a lot more in detail, what has happened and how it could change things.
Especially with patients with recurrent pregnancy losses, biochemical pregnancies, in which even they don't even know that it's a miscarriage. Most of them don't even consider that that's a miscarriage. They just feel that, okay, it's just a line was seen, 2 lines were seen on the pregnancy test, and then I just got my period. So most of them don't even consider that it is a miscarriage. But we have to elucidate the history and then treat accordingly.
But I have a question for you, Dr. Amita. I know as a lot of my friends are now in the US or, let's say the European part of the world, folic acid is not given to those particular set of people in America or UK.
In a lot of the European countries, their food is already fortified. Sure. Our Indian food is not folic acid fortified for that matter. I think our only standard government fortification is salt and iodine. I think that is the only fortification we have. We don't have folic acid fortification here. It is there in European countries. So in which case they are getting their dose of folic acid.
Sure, got it.
So just to add one interesting point in the history of this folic acid, how it came. In 1990s, I have read that neural tube defects, despite giving folic acid, in which women it occurred, they have checked why it is happening because they are already on good supplementation. Then they checked for these antibodies and then they found that these women are having high level of antibodies. After maybe 10 years down the lane, they started doing the same thing for kids with who are having this cerebral folate deficiency. Can we check the antibodies in them? And maybe somewhere in 2004, first time they reported that these antibodies are there in these cases, and when they are giving folinic acid, it is showing good improvement.
Got it.
Even in babies or in mothers who had children with neural tube defects, when we are giving them to women who are having their first pregnancy, everything's going well, the dosage we recommend is not very high.
Okay.
But if they have had a neural tube defect, the dosage recommended is 5 milligram. If they've had a recurrent neural tube defect, the dosage is again much higher. The simple logic there is we are trying to circumvent these antibodies which are blocking by giving a higher dose of folic acid. In these patients, probably identifying that they have a receptor blocker, an antibody, and then giving them directly folinic acid or leucovorin kind of, solves the problem directly.
Got it. Dr. Lingappa, this is for you. Which children with AST are most likely to benefit from leucovorin?
Yeah. So as we talked about the FRAT test, if the titers are more than 5 times, generally they might benefit. So the evidence is still accumulating, although the usage has been started from almost 2011. And there are studies, small number studies, which have shown there is improvement if you are given for at least 3 to 4 months. And then they have found improvement in the hyperactivity levels or the understanding levels. It does not actually converted into improved speech output in most of them. And maybe Dr. Deepthi will also add her experience. She has collected some data. We are using it. We are yet to get the feedback after 4 months. So it is useful, but whether it is going to convert into a significant change, that we are not sure, because one of our colleagues has been using it for last 4 years.
Sure.
And we have seen very limited improvement in many of these children on follow-up. So I think a very structured study on maybe hundreds of children and having their follow-up and correlating with their FRAT test antibody levels, whether it's 5 times the titer, or what is the actual thing, or it is going to correlate only with the IQs and other factors, we need to look at. Dr. Deepthi can take few questions.
Like one of the question you asked, what else can we test in them? Is it? So apart from the antibodies, probably there is some good evidence that level of homocysteine is also getting correlated with who can benefit from folinic acid. Basically, there are 3 main mechanisms in which folinic acid can be beneficial. One is like the blocking of the antibodies. It's like the door is there, but it is shut. So you can't bypass the door. So you're taking an alternate route. There is another mechanism where what they're saying is inflammatory process itself is very high, which is reflected in the form of homocysteine indirectly. That means that even if it is taken inside that folate, it is not sufficient for the whole of the methylation that is occurring. And the third level is maybe a little more down at the mitochondrial level. Mitochondria are the energy sources in our cells. So their dysfunction, if it is there, these children probably are unable to maintain only on the dietary folate thing. So for them, giving an activated form of folate may help them. So the test which we have recently made it like a panel actually has one from each of the things, like antibodies are there, homocysteine level we are checking, indirect evidence that RBC folate, if it's very high, it's like there is lot of folate in the blood, but we are not able to enter into the brain. And the child is not on any exogenous folate supplementation, but still their blood folates are very high. That could also be one mechanism explaining that maybe there is a deficiency inside. And then to find the mitochondrial, this thing is very difficult, and I don't think in all the children will be doing mitochondrial sequencing and all those things. But indirect markers, like if there is an elevated lactate or if there is elevated alanine in the TMS, and the biochemist would be helping us from the lab to determine which subset has shown some markers which might be pointing towards a mitochondrial kind of dysfunction. So if this combination is there, then those kids are more prone to improve. But like sir said, it is still emerging. So we really don't know. And there is no direct correlation with, like, if a child with severe autism comes, his antibodies have to be high. There are many kids with autism who don't have antibodies positive. So this is only one mechanism. It is not the only way to explain autism.
Okay. I will have this question for you, Dr. Lokesh. Help me understand, what do you mean by the spectrum? And I also read that there is autism grades or levels. How do you define that? This is for a layman like me.
Yeah. So initially the term autism was used as a single this one, and they used to also have the lower severity spectrum was differentially called. Now all the terminologies have been fixed into autistic spectrum disorder.
Yeah.
So somebody can be verbal, somebody can be non-verbal, somebody can be independent to a certain extent, somebody may be dependent. So it's a varied spectrum. So it all depends on the scoring systems helps us to understand.
Sure.
Either you might be using DSM-5 criteria or a CARS-2 criteria along with IQ. So we always suggest to do these scoring systems always with the IQ, because what we have found in our own follow-up study is somebody who has a better IQ has a better chance of being independent. If you have IQ 80 and above, you know the average IQ is classroom IQ is 91 to 110.
Correct.
And this, as a group of autism children, they have average IQ of around 65 to 70.
Okay.
So if there is a small group of children who have IQs towards 80. So those children, when we followed up between 6 to 8 years, they have become independent. They're going to regular school, maybe with some extra support, but still they have a little bit reduced socialization. They can't easily socialize. Their eye contact is still limited, but they manage themselves without any support.
Sure.
They don't require therapies. Somebody who has average IQ around 60, they still are dependent, requiring support. So we are just trying to explore what determines this IQ within this group of population. That is not very clear. So that is why we call it as a spectrum, where you have children who can do everything for themselves. You have children who are very good at something. And we had a child the other day, you write something without knowing, he'll say what you have written.
Oh, wow.
You'll just tell.
And where does the IQ go in this? Because I've heard from a mother that her son speaks some 100 languages, you know. And then, of course, you know, kind of there are some really amazing, you know, kind of, I would say Netflix shows like The Good Doctor, etc., where you see that the IQ is absolutely phenomenally very good than an average human also. So how do you sort of classify? So what I also understand is IQ is one parameter for autism.
In the sense, well, the parameter for autism testing, if you have to label somebody as autism, you have scales which doesn't always include IQ as a separate parameter.
Got it.
So what we suggest is we always do as a parallel this one, because one of the severe forms of autism, like you have CAR score of 37 or 40, then you know that they're very severe, they're going to be dependent even from the beginning. But most of them, the run-of-the-mill autism is around 30 to 36 CAR scoring, which is mild to moderate severity. And these are the children where we are trying to assess who is going to be easily independent, who is going to be dependent, and how to improve them from this one. So there we get this spectrum where you have children who can do very well, who can be dependent. So
got it.
Like for
Just
a
to add,
simple,
I think,
So just to add to what doctor just said, measuring IQ in an autistic child is very, very difficult for us because most of them have receptive language issues. And in IQ, there are two parts. One is performance and the other is verbal. In the verbal part, the questions are asked orally, and if the child's comprehension is poor, he doesn't even understand the question, so he's not going to answer, so we have to score 0. So that affects the overall score, and sometimes kids come under 60 or 50 IQ, but I know that child's IQ is way higher, but I'm not able to measure the child's IQ. We have other IQ testing mechanisms, but they are also very difficult because sometimes a child is not looking at the picture when we want them to look at the pictures, looking away. So how do we factor in those things? Because these are inherent autism behaviors. They don't understand how important it is. Like for example, if you're doing a neurotypical person's IQ testing, they know it's an important test. I need to pay attention. My score is important. Like an exam, for example. Like I know that I need to better perform. Otherwise, my score. A person with autism doesn't have those concepts of, you know, why that exam is important. So they might not even write they know all the answers on the paper, but they don't write the exam. So those gray areas can never be addressed in autism. Those will remain gray. And scoring, I've seen hundreds and thousands of kids where we have done IQ for autistic kids. I know that we are not doing justice to that kid because that kid just doesn't even look at like one puzzle he has to solve, and it's time bound. If he doesn't sit, how is he going to solve the puzzle? But I have to start the timer and score him low because he didn't finish it on time. He doesn't understand the importance of timing in that. So most of the IQ tests are made for neurotypicals. They are not made for neurodivergent children, unfortunately. Even now, that's the case.
Yeah, I think that's why somebody who has done an n number of children with autism to say average this one. Somebody who is just doing it for the first time, who have done hundreds of typical ones, scoring a neurodivergent child is always a challenge. So somebody with gaining that experience, this is okay for this child.
They have to take some liberties as a clinician to score them, even though they are not performing. I do that because I feel that I know that child can do, but he just is not able to get my instruction. So I'll score for the child because it's not absolutely written in stone, you know, for children.
So that also brings me to a point where I feel that the way we are measuring the IQ needs to maybe evolve, you know, and we're still stuck with age-old methods and tools and techniques, you know. So I think one of my questions for you, you know, Dr. Amita, would be, which pregnancy-related conditions have linked to increased likelihood of an autism?
See, now autism, now we are talking about the link between autism and now folic acid deficiency. There are other things which are also linked to the exact same folic acid deficiency. For example, if we have mothers, like very young mothers, we have women who have had recurrent miscarriages. We spoke about that.
Yeah.
And women who have these folic acid receptor antibodies, they are at very high risk of pregnancy-related complications like, for example, preeclampsia or growth restriction, preterm deliveries. So all of these babies, if you look at them, we don't categorize them as high risk for autism, but because of their preterm delivery or because of the IUGR, the growth problems, they come into the high risk category. We don't really specify it for autism, but I think in this group, the incidence of autism is a little marginally higher than the general population that we would look at. So I would say any condition where the growth or the development of the baby is affected comes into the risk group. And as I said, the folic acid plays an important part not just in the development of the brain of the baby, it's also the development of the placenta, the metabolism of homocysteine, the DNA methylation. So it's a part of very intrinsic, very essential steps very early in pregnancy. So these tend to have a long-term impact, and just the way like folic acid receptor antibodies is not yet proven, I would say these are things that still need a lot more study for us to be very categorical about it. But yes, they do have a difference. They are at a slightly higher risk.
And in those higher risk, let's say, I've had friends where I have seen that there was, let's say, the fetal pole not seen, or there were a few of these things that were supposed to happen in a particular time tenure during the fetal development, and they've not occurred. Do you recommend us to get the whole exome or the FRAT test during those times as, IVF specialist and a fetal practitioner?
In a woman who has had previous history of, say, preeclampsia or growth issues, then yes, I would consider it valid.
Sure.
And there are cases where the stages of development of the brain, for example, we start off with a brain which looks like the surface of a cabbage, few little dents and that's it. And it ends up like the surface of a walnut, which is very compact and very, lots of indentations. Now, this progression is, each stage has a certain pattern. If we find any variations in that pattern, which is indicative of a neurodevelopmental problem, first thing we look at is genetics. So that is where your whole exome comes in. I would probably not do it for somebody who's had a miscarriage, but I will do it for a person who's had a baby who had a neurodevelopmental problem. And these, I would probably consider FRAT as an add-on test where the whole exome looks at the genetics, but it doesn't really look at the folic acid metabolism. So probably an add-on test here. And we'll still have to see how much of positives, how much of validation this test, or how much benefit this test is going to give us.
And a small thing is, one miscarriage, it is pretty common. So these tests are generally advised for people with recurrent miscarriages, which are the ideal definition of recurrent miscarriage is more than 2. 2 or more than 2, then definitely, we have to advise these.
Okay, got it. My question would be for you, Dr. Deepthi. When you encounter children with developmental delays, what tests do you typically recommend to such parents?
On a larger level, like developmental delay is a huge thing. Like it could be structural problems, there could be chromosomal abnormalities, or there could be problems like autism and all, or there could be some unfortunate event that has happened in the immediate perinatal period, like HI babies, like hypoxic babies, or some post-meningitis babies. All will fall under developmental delay. So each case has to be seen separately. So when the child comes, apart from looking at the milestones and all to quantify the delay, how much is the delay, we also look at, is it pointing towards any particular disorder, like the head size itself is small or very large, or the face itself is syndromic, the child is very short statured, he has some organomegaly, some facial features which are very striking, then in that case it will be tailor-made to that particular patient. It starts with an MRI if we are suspecting a structural problem. If they are associated with seizures and all, maybe an MRI and EEG. And then if you are more suspicious about any genetic disorders, then we have 2 things, chromosomal microarray and whole exome sequencing. But all these are done in a stepwise manner, not like at once we write everything. And then if a child has completely otherwise normal motor milestones like our autism kids, we are not really suspecting structural things there.
Sure.
If the parents can afford and it's the first child, we are offering them a whole exome sequencing and a CMA to know the cause. But the chance of picking anything abnormal in that cases are with all the research of today, is around maybe 25 to 30%.
Probably even
Probably
less
so.
than that.
Even less than
that.
maybe 20.
Yeah, so I think it's probably somewhere around 5 to 10% is what we get a exact one single gene
One
disease.
single gene.
Single gene disease.
Yeah.
So in fact, one of the important thing we as clinicians should be aware is to look at autism mimics.
You were saying
autism mimics.
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 Okay.
Like they have a organic disease, like phenylketonuria, which they have epilepsy, they have golden colored hair, which is non-feminine in nature, skin eczema. So if they come, we have had children who have been diagnosed as autism, treated with therapies, and then at 2.5 years, we're diagnosed as PKU because we don't have a mandatory newborn screening.
Okay.
Extended newborn screening, which is picked up otherwise if you do that, and you can treat pre-symptomatic. Similarly, cerebral creatine deficiency. So that also has microcephaly, epilepsy, and autistic features. And in fact, you can have Duchenne's muscular dystrophy, which has speech delay as part of it. And they come to you with speech delay. They also have maybe subtle motor delays. They started walking at 18 months, 20 months. So, and then later on by 3 or 4 years, you are already treating them as autism, and then they develop motor difficulties. And there you find out. So a lot of boys, we have slightest of suspicion, we do serum creatine phosphokinase to pick up any early Duchenne's muscular dystrophy that has slightly increased risk of autism. And similarly, a structural abnormality. So as Dr. Deepthi rightly mentioned, you look at the head size. Normally in typical autism, you have a normal head size to slightly on the higher side. If you have a very small head size or a very large head size, there you are looking at a structural problem or a genetic problem. So those are all the clues, and then skin markers. So a child has significant autistic features, and there are conditions called tuberous sclerosis complex, where you have skin markers. And these are conditions where they have risk of epilepsy and other organ involvement. So you'll have to look at all these things systematically to make sure when they come to you in the first examination, I'm not looking at a genetic condition or a structural condition associated with this, where the treatment and the management is completely different. Once you have ruled that out, you know that these are the only things you need to do therapies and continue with this.
Got it. Again, I'll ask you this question, Dr. Lokesh. Are there any risk or side effects associated with leucovorin?
Yeah, so they're not risk, you cannot say it as risk, but we have seen side effects kind of thing. So if you have started with the higher dosages, the recommended dosage is around 2 milligram per kg per day. So if children who are hyperactive, this has shown to increase hyperactivity. Increases the meltdowns. So we are starting at a very low dosage and starting with half a tablet of 15 milligram, increase it to 1 tablet and maybe to 2 tablets in some children who are able to tolerate it. So that's where we are not given more than 30 milligram in a day. And Dr. Deepthi can share her experience.
So recently we have started this because as we were discussing, in India there are very few studies on this. Only one from AIIMS Rishikesh was done in 2023-24 time. It also was done on 40 kids. So they did publish that it has shown some improvements in the speech and cognitive aspects. But after that, we couldn't find any further studies, at least in India so far. So the recent one which we are started giving, I could collect the data of around 75 kids so far. Among that, like sir said, almost 1/3 of the kids said that irritability, hyperactivity increased in the initial phase, but it was more or less transient. For around 10% of the kids, it was little persistent, but most of them did settle down. And coming to, is it beneficial? It is too early to conclusively say that yes, this is beneficial, but it is showing some good results. Like around more than 50% of the parents were saying that they could note some positive changes, predominantly in the areas of cognition and receptive language. And surprisingly, of interest is the expressive language for all the parents, but 40% did say that they have noted nothing, no change. 60% said that they did see some positive changes, like they were saying words, means they are now number of words are increasing. If they are already in phrase level, now they are making their own new sentences, that kind of thing. Around 5% of the kids have to be discontinued because of extreme hyperactivity and irritability, and there was no improvement, and also they did worsen 5%, so we had to stop in between. Like sir said, it has to be increased very stepwise. Parents are cautioned prior that this could be the side effects. If you see the side effects, keep on the lower dose only. And along with folinic acid, we are adding the other B complex vitamins also, so that it is, the pathway is not like suddenly overloaded. So B12, B1, B6 also we are adding in a prescribed dosages. With that, I think we are able to manage most of the hyperactivity.
Okay. So what I also understand is when, kind of leucovorin, etc. is being given in, kind of very measured dosages, what is the tenure that you're looking at or the parents are looking at to see these notable changes in a child's behavior?
Many studies have seen around minimum of 4 months.
4 months.
Minimum.
So this is 120 days. I am assuming.
120 days, at least 3 to 4 months. But most parents are reporting back maybe somewhere between 3 to 4 weeks, saying that whatever changes they could see. And whatever I could collect the information on the studies, they continued till about 1 year. If there was a positive improvement, plus there was some biochemical evidence of this problem like antibodies or homocysteine very high levels and all, they did continue for about 1 year, but not at a very high dose. After the initial 3 to 4 months, they tapered it like 20% every 1 or 2 months and came down to a very minimal dosing of maybe 5 to 10 mg per day. And they say you could even continue 2 years if you are really seeing very good improvements, but it is too early for me to say.
Got it. Got it. I'll have a question for you, Dr. Madhavi. At what age do children typically start coming to CDC for the therapy?
Even today, in spite of all the awareness in social media, children usually come to me around 2.5, 3 years. Very rarely I get children who are 18 months, 16 months old with some symptoms of no eye contact or no response to name call. Some mothers read up on their own and they kind of proactively help. But even now, parents are in total denial when a child is not speaking. They just think it's a family thing or the dad spoke late, so the child also is likely to speak late. All kinds of excuses we tell ourselves. They're scared to go and get a diagnosis because they kind of know there is something wrong, but they still postpone.
There is a constant denial as I see from a lot of parents. You know, that my child, for every mother or a parent, the child's the best, right?
Yeah.
And I see a constant denial in a lot of them. I'm very sure both of you, the three of you, are seeing this happening more now, right?
Sometimes they come to both of us, one after the other, and they test each other. If his report matches mine or mine matches his, or maybe even because they don't tell that they already got the test done in Rainbow and they come to us and then we do the test, then they take out the Rainbow report and show us, report is matching. That means what they have done in Rainbow. I find we don't know because when you are a parent of a young child and who you love and adore, they're always looking for
picture perfect.
Must be a false positive in Rainbow.
Maybe they just scared to accept.
It's a constant denial.
Yes. And mothers are so guilty. They think that they have caused it. Especially in those cases where there's a lot of screen time and mothers have given them 6 to 8 hours of screen time. And another pattern I see is a lot of NRI parents who come to India, both husband and wife are working and they mostly work from home. They give screens to their children because at least in India we get some help. There is no help at all. So the cheapest babysitter is a screen, so they just get the screen for the child and they're perpetually guilty that they caused it to the child. So it's very complex when your child gets diagnosed with autism.
And maybe there's a lot of blame game also going on.
Yeah. A husband will ask me, do you think this is caused? I find it miserable that, instead of trying to look at the child to help, they're trying to find how does it matter who caused it? It's already there now. You need to address the challenge.
Sure, yeah.
I told you, right? I was telling you, that some parents even consider marrying second. Husband's family puts pressure on them saying that, no, you can't have another child. Maybe the next child also will have autism. So get another marriage. Get a new wife. All kinds of, these women go through a lot, They're guilty. On top of it, this kind of family pressure. Their mental health goes for a toss. Mother need a lot of mental health help. It's very
I
tough.
think that's an independent area completely.
Completely,
Mother supporting
completely.
the families there after the diagnosis. In fact, we are trying to create a system.
Yeah.
After the diagnosis, once they walk out of the room, the parents have to have a hand holding
Yes.
for some time, both from the psychologist perspective. Many of them are developing early diabetes.
Because of the pressure that they're taking.
Stress,
Pressure.
this one. So I think that is another part of the thing, the society we need to create. And maybe some respite care systems, which is non-existent in India. At least once in a month or once in 2 months, they can go out and have their time. So that is another aspect we probably have to develop in our country. And the other thing which we have found in one of our trainee studies, more than one non-working member in the family is protective. If mother is non-working, it doesn't protect because she has n number of things to do and she doesn't have another person to talk. So more than one non-working member who are active, interactive, that has a protective factor. When we compared 170 children neurotypical and 170 children with this one, these were the factors we found.
Wow. And I remember talking to you, Dr. Lokesh, where you said that after the COVID, the cases of autism, primarily who are looking at you per month, have grown up significantly.
If we used to diagnose around 50 a month before that, and by 2021, 2022, we started diagnosing 150 to 200 per month.
My God.
And just to put to perspective, this is not genetic. When I was training in NIMHANS 2002, my professor called to the room and showed me this is how a child with COVID looks like. The autism looks like. So from 2002 and today my trainees tell, sir, I have seen already 5 cases today, don't give me another child of autism to evaluate.
Not only trainees, I mean, we also normally keep seeing
Everywhere.
No, what I'm telling is the number increase from in 3 years of training, I had seen one child. That too, they had traveled from US. So what has changed so significantly? It's our lifestyle, that the way things have changed from combined families to nuclear families and the work environment. A lot of things have changed. So it's a socio-cultural, or the change is not just a genetic thing which is happening.
Exactly.
So we need to address those aspects. Otherwise, no genetic disease will be diagnosed or increasing so significantly.
And when we talk about autism, it's very difficult for the parent to understand that it is not like you find a test, get a report and it's diagnosed. The fact that it is something that is socio-cultural with a genetic predisposition, probably, they'll come to you and say, my previous child has autism, now I want a genetic test to rule it out. They are not able to comprehend that there is no single pinpoint test. It is something that is, multifactorial, something which is like, very difficult. When we talk about autism, they are like, is this the cause? We don't know what the cause is. And that's very difficult to accept. It doesn't close the loop.
But tell me one thing, Dr. Amita. I mean, there is a family, let's say, they have their first child as an autistic child. How do you rule out, or basically, how do you evaluate, that the second child, there is supposed to be a sort of a pattern? What are the kind of tests that you, in your experience, would recommend to such a couple who've had their first child as autistic?
See, the first thing I would probably do is probably go through a very detailed evaluation of whatever evaluation has been done for the first child, which we call as an index child. See if there are any pointers. Genetics or genetic testing, I would offer with the huge, disclaimer that most probably we are not going to find anything. The genetic test there is probably just like, to complete the evaluation, but you're not going to find anything most probably. And the counseling is very, very important. The couple need to understand that, yes, we are doing our best to find something that might help you, but most probably we are going to be at square one right through the pregnancy. We might not find a cause. We don't know whether your next child is going to be affected, and we can't really do much to help you there. So I think we are still a long way to go when it comes to handling autism or its inheritance pattern. Tests like your FRAT test, yes, it is kind of one more test which probably gives us another, thing which we can tick off and say, okay, this is not it or this is it. But it doesn't complete the evaluation as such.
I have realized one thing, Dr. Lokesh and everyone. I've read biology is the science of exceptions. So, and when it is exceptions, I mean, what we are also talking is maybe there's an exception. But my 2 cents on that, what you just said, and, kind of, I'll then let you speak, Dr. Lokesh, because my next question would be for you, is that if as a parent, kind of my first child is autistic, I would rather do anything to ensure that the second one is okay. So for that, I don't mind spending money for DNA, because I'll tell you a very interesting example at Yoda only, where there is a DNA comprehensive test that we do. And in that test, there was a child who was actually autistic. And it showed that genetically it had a strain from the father. Of course, the idea that we had, and what you were also speaking about, having these kind of marital tests done for your compatibility for a child, sort of gives you an idea. I'm very sure it is not like 100% there, but at least it gives you a direction. Do you agree with that, Dr. Lokesh?
No. I think here it's a topic, I think what we need to look at is first child is diagnosed with autism.
Yeah.
So I'm going to, so that's why we need to see a developmental pediatrician, a neurologist, to make sure we are not dealing with a secondary cause. Run-of-the-mill autism kind of thing is where development physically they are normal, their physical examination, growth, no epilepsy, no visual disturbances, hearing normal. So then you are a typical autism child. There, the addition of genetic testing does not add any value.
Exactly. So your typical autism doesn't have a genetic locus.
Genetic locus. If you have any of the other features, like they walked a bit late, they had a large head, they are a small head, or they have early onset epilepsy, they have some movement disorder associated with that, there my yield of genetic testing is quite good.
Sure.
Rest of them, we don't get a genetic yield. Okay, that what Dr. Deepthi was also telling. Maybe on 10 to 14% in a recent study from Mumbai, what we have seen. So then if you have an index child diagnosed, it becomes easy. You just do the testing in the next child. Rest of these children, what I tell the parents is, see, in a year, if I'm seeing around 500 to 600 children, families with autism or that number, apart from the monozygotic twins, where the risk is high, obviously, in there to be having autism together in the family, 2 consecutively born children having autism is extremely rare. I might have 1 or 2 families. In 500, 600 families I see.
Sure.
So that gives the family's perspective and confidence and hope that it is not so common to have the second child to be born with autism. So that might help them.
So what the parents are not expecting from us is not a very medical kind of answer, like this is the percentage of
that
risk,
doesn't help.
this happens. For them it is 100%.
Yes.
They don't care like
Numbers.
3% of the children
Very
had
true.
a recurrence risk. Who cares? Does my next child have? So exactly like how sir says, I tell, we have seen maybe so far around 2,500 kids of autism. I have not seen siblings having autism, maybe not more than 20 to 25, which makes it a, like how
Small
sir is saying, very small proportion. Now that is up to the God's will. What you can do is, if you are so anxious, because anxiety itself can cause a lot of other things in the pregnancy, and even if we tell that the percentage is only 10% catchment rate, many patients are like, please do it. Even if it is 1%, do it. So for their anxiety getting early, I think we can write a whole exome sequencing, and if it is normal, they are happy, at least the pregnancy goes on happily. But there are many times the autism kid, before the diagnosis of the first child, they already have a second child in India, because the gap is hardly 2 years. So they already completed the family. We say it's fine now. You can ignore it. But we have to give them in a, I think, a true normal perspective, like out of so many things, we haven't seen this. If we quote a percentage, it is unable for the parent to decide. If we tell them like this, they are like, okay madam, we are happy, we'll go ahead with the second pregnancy. We haven't seen really so many siblings. Book quotes, I think, around 10%.
Yeah, the Western studies quote a very high incidence. We don't see that. We don't see that.
Maybe 1 to 2%.
Yeah. So because the epilepsy also in autism is to be quoted as 10 to 30%.
That much
But
we are not seeing.
hardly see.
are not
We
seeing
hardly
that.
see, unless it is a genetic this one. We don't see.
Got it. Again, I'm just sort of ensuring that your time is taken care of. Dr. Lokesh, once a child is diagnosed with, autism, what is the right time to start leucovorin therapy?
Yeah. So I think in that perspective, I don't think so we have information.
Sure.
Okay, so whether a 2-year-old can be offered, because we diagnose formally as autistic spectrum disorder only at 2 years and above. Otherwise, the screening tools, MChat and other things, by 18 months also you say you are at risk and start interventions. We don't wait for the formal diagnosis. You have high risk, you put them into school, stop gadgets and make sure their attention is good, and then all the therapies, at least occupational therapy and other things, they are referred to. But whether you should start at them, we should do the diagnostic testing at that time and then start, I don't think so I have the answer.
This out of these 75 or 100 kids we had, average age we saw was 4 to 5. The presentation they are calling us for, because they have tried everything else by then. And now a parent will see this thing from a different angle, not from a medical angle. Should I start at 2 or 3? He will think, if there is some hope, let me try as early as possible. So they are calling as early as maybe I can say 3 above, but median age I saw was 4 to 5, because they have tried everything else. They didn't see huge results. Because in autism, like sir said, what we exactly mean by spectrum is, see, if you say ID, intellectual disability, and you give a number 80, that means all the kids on an ID of around 80 will be more or less the same way of understanding. But in autism, it is completely different. A scientist could have autism, or maybe Elon Musk has autism. We say Mark Zuckerberg has autism. That's why they are totally channelized into their own this thing and not into anything else. But the other end of the spectrum could be a very poor cognition child, completely dependent on the parents, completely non-verbal. Even he could have autism. So spectrum means like very low to very high. Capabilities are hugely varying.
Got it.
I just want to add one more thing, that a lot of children with high functioning autism get missed out even for autism diagnosis. So there are 2 types of autism. One is the standard autism, what we call, and the other is called the high functioning autism. So most of the children who have standard autism, they get diagnosed around 2 to 3 years of age based on when the parents notice all the delays. Okay. And in high functioning autism, there is no speech delay. Okay. The child's speech almost looks neurotypical like speech, but they'll be a little more geeky or more focused towards one area of expertise, like expert in cars, or, you know, like all kinds of, parents think that, oh, my kid is super smart and they're very
He's
happy.
a prodigy.
Prodigy. He's a
We
prodigy.
claim it as a prodigy.
Prodigy. And the parents are pretty happy because we are very academically, we celebrate academic achievements.
Yeah.
These kids are academically very well, and parents think that, oh, this guy is going to IIT.
Yeah.
Or becoming some scientist or something like that. Okay. By the time they come to 5 or 6 years, you start seeing a huge gap in social development, and you see children will have all these socially inappropriate behaviors, not able to keep friends, or children trying to avoid this kid, or he doesn't know how to have a conversation with his peer, or wants everybody in the class to play the game that he wants to play, and behavior issues start, social and behavioral difficulties start. That's when the teachers will say there's something off about this kid. They might think it's but the child has good attention, there's no attention related issues, only behavior issues. Those kids come to us a bit late at 6 or 7 years, and then we do something called high functioning assessment for autism. And their IQ, then we have to do it with IQ, because once a child crosses 6 years, we cannot do only autism assessment, we have to do IQ as well. So we do the IQ assessment, their IQ goes through the roof. They are very high IQ kids. That's why the academic performance is very high, but there's a huge gap. It's like if you watch Sheldon Cooper in Big Bang Theory, they are the Sheldon Coopers of the class. They're extremely highly intelligent kids, but with a lot of social issues. So a lot of parents connect when I say, did you watch Big Bang Theory? They say, yeah. So your kid is like Sheldon Cooper in Big Bang Theory. So these are the kids who are the Sheldon Coopers of the class with social difficulties. People dislike them because they are come across as mean, because they know they're like walking, talking encyclopedias of the classroom. Immediately they'll even point out the teacher's mistakes because they know the subject so well. So this is something that we tend to miss in India a lot. In developed countries, the systems are in place for catching them young, but in India we don't have any system. We are dependent purely on parents to bring the children to us for diagnosis. So that's what is missed. Another thing that we miss is Rett syndrome, isn't it?
Yeah, the mimics, yeah.
Yes.
So it's in girl children, when they are not speaking, they have typical hand wringing movements. They don't use the hands for any function. The brain is connected in such a way, so they cannot hold a cup, they cannot do any activity. So constantly they are doing that. They have epilepsy, they have regression of milestones, and they have all the other autistic features like lack of eye contact and rocking behavior and other things. So it's in 1 in 10,000 to 1 in 12,000 girls develop this genetic condition. So it's phenotypically you're able to pick it up in the first 1.5 to 2 years. Maybe slight overlap would be there, but the course is so significant that it's clinically diagnosable and confirmed by the easy genetic testing.
Okay. But I'm just so shocked what you just told me. It's like socially awkward kids can, or people can also be autistic. And we're just like considering them like prodigies, while the other state of how, you as clinicians would look at them is very different.
I just did a course a few years ago in UCLA. It's called Peers. We work with only adults with autism who have social difficulties, and this course is designed for teaching them social skills. Like especially again in the US, because it's designed in the US, there's a whole chapter on dating. These kids, these young men and women don't know how to date, how to ask someone on a date, how to go out and all that. Or even other social skills they don't have. They don't know how to start a conversation. They struggle a lot. So they'll have a lot of mental health issues because they feel rejected by peers. They don't know why they're getting rejected. They try a lot, but it just doesn't work. So UCLA developed a program called Peers, which I got certified in. And these kids, we train them in social skills to how to go on a first date, how to ask a girl out, how to sustain a conversation.
I don't know how
my husband said I would have taken up this course.
But now it's like, now thinking back, you are... I'm sure for all of us, it's like so many people we know, we are thinking of like maybe.
Yeah. I'm just like trying to bucket them now.
And maybe in India, parents were very proud if they had such kids who are not dating and who are just studying and all. So they...
No, I have
as doctors, a lot of us were like that.
A lot of kids who come to me, adults who come to me now with autism from engineering colleges, high functioning autism, parents are now going on UCLA website, finding somebody trained in peers, and they're coming to us for peers training for their kids, And these are like really, really smart kids with 95% in engineering, BTech, MTech, got into Ivy League universities, but struggling with other areas socially.
I think what you both are saying is that social interactions and that social, kind of, I would say, relationship building is so important, overall for your development, which I think because of COVID, we were lost somewhere, Severely, we were just derailed, and now it's the time to sort of reconnect. That also brings me to this very important point where I feel we were just texting people for their birthdays. I would just rather start calling them now,
I've been doing this for last 2-3 years, not 2-3 years. We arranged a get-together, MBBS get-togethers. So I had to call everybody to come and attend. It was in Hyderabad in 2018. So from that day onwards till date, everybody is now expecting a call when they were their birthday. Then if I have not called that day, what has happened to him? He's not calling me. So I've stopped texting anybody. So I just call them.
I think one takeaway for all of us, and I'm very sure for the production team, is also to call and get it sorted for the social interaction. So I think my next question would be for you, Dr. Sita. Research shows that there is slightly higher risk of autism spectrum disorder in children conceived via IVF or other fertility treatments. What does your experience say around the same?
See, there is no direct causal relationship. If autism, the general risk is 0.1 to 0.2%. In IVF conceived kids, it's 0.2 to 0.3%. There's no direct causal relationship, but the underlying factors, the advanced age and any other male infertility causes, or when the patient, generally infertility comes at a higher age. So when they're coming to me at a higher age, they're at an increased risk of autism when they're having kids, even naturally also. So it's mainly the underlying factors which are mainly responsible for increased risk of autism rather than IVF alone.
Okay, got it.
And a lot of the IVF pregnancy, the women are at higher risk of pregnancy complications also. So that in turn adds to the risk.
And generally IVF, most of them, they transfer to embryos. So multiple pregnancy risk is increased. So preterm delivery risk is increased, low birth weight, preeclampsia risk is increased. So all these are actually a high risk for autism. But IVF per se, if we do a single embryo transfer per se, there's no much increase in autism.
Okay.
So to add to that, many parents ask me, is the premature birth kids are going to be at high risk for autism, not the IVF. I say, but by experience, we have seen that more than 95% of kids were term uncomplicated pregnancies with no clue towards any delay till they were around maybe 9 to 12 months minimum. From then onwards, they started noting some aloof behavior, but by the time they could catch them, it was like 18 months to 2 years. By the time the family could take that acceptance and then come to a doctor, it is somewhere like 2.5 to 3. But surprisingly, prematurity has not been linked. We see as young as like now 600, 700 gram babies going out of ICUs after 3 months of stage. Rainbow and all will be having like hundreds of babies like that. And there is no correlation to autism with that, which is surprising. ADHD maybe still more correlating to prematurity, but autism so far there is no correlation to prematurity.
There were two things that I was reading up. One was the mother's stress levels during pregnancy, and typically IVF pregnancies are multiple IVFs and third round, fourth round. The mother's under constant pressure. If I'm going to have this baby or not, will I have a miscarriage after a few months or a few weeks? That adds to the mother's stress, and sometimes mental health issues can also happen, like depression and all that in mothers. And I mean, I lost my second thought, but there were two factors that, I was studying about IVF because a lot of mothers nowadays are coming to us with history of IVF babies, and we do see that the way they talk to us, they are extremely stressed out.
Because of their stress, even preeclampsia risk is increased.
Yes.
Placental health is compromised because of their stress. They are scared whether the baby will go up to term or not because of all these Google information. So they're all, even to go for IVF and even to go till term, they're really scared whether that will happen till then. So they are really stressed out. So
and studies with mothers who have been put on bed rest for various health conditions during pregnancy. Also, if you followed them and their babies, they've had a lot of developmental issues because the mother did not move at all throughout the pregnancy. The child never got the feedback because the only way the child will move or get any gravitational feedback is when the mother moves. So these mothers who are lying down for various reasons, or modern day lifestyles where mothers are sitting 12 hours a day and working in front of a laptop, those mothers also, when they have children, they have sensory processing issues after the children were born. So these were the...
So here again, that first 1,000 days, it comes into place. So while the baby is in the womb, what happens is very important. And like things like talking to the babies, playing songs, all of those things, we cannot probably quantify the impact, but yes, it does play.
I think since times of Mahabharata, that is.
Yes.
That is.
and maybe one more reason is people consider IVF babies are very precious babies. So even though we say that, bed rest is not required, move, the family and everybody, they make her sit, they treat her
Like a
real,
princess.
yes.
The
They
way
don't
the
let her do
IVF
any
mother
work.
walks is different.
Yes.
She'll be like slow, step
Slow.
by step.
they generally think that bed rest improves their chance of going till term, but it actually doesn't. And all these, they make her stop the job, everything. So she's just at home thinking whether this will happen or not, this adds on stress to her.
Got it. Dr. Lokesh, how important do you think genetic testing is, and how can it potentially change the outcomes for a neurodivergent children?
Yeah, I think we have covered partially in the previous discussions. So we go through a thorough clinical history and clinical examination. So if I have red flags, I am looking at autism mimics or a genetic autism. So when I say genetic autism, there are a lot of genes which are working on the synaptic level. So if those genes are abnormal, there are like SYNGAP1, tuberous sclerosis complex, CDKL5, there are a lot of these genes which are working specifically at the synaptic level. So basically autism is at the synaptic level, your connectivity is not working. So that genes will cause autistic spectrum disorder. So if there is consanguinity, high degree of consanguinity, and then the child comes with autism, then maybe you're looking at trying to do a genetic testing. If you're doing a genetic testing, we always do whole exome, chromosomal microarray, Fragile X. All the 3 tests have to be done. So if you don't have any clues, you are doing generically genetic testing for a family. with first child with autism. And if you have clinical clues, like I have a child with large head and then there's a skin bump, there is something called Cowden syndrome, which you can pick it up on the whole exome sequencing. So if I don't have clues, I will include all the 3 testings.
Got it.
Yeah.
And then the last question for you before you say bye to us.
Yeah.
What are the other tests that you would recommend for neurodivergent kids?
Yeah, so we do, as previously discussed, the homocysteine levels, thyroid testing, just some of the things which are easy, simple to be done, and there are easy treatments. And if there is a neuronal regression, like not neuronal regression, speech regression, I would say, that the child was speaking few words and then lost. So autistic regression it is called as, it is seen in almost 1/3 of this population. So that is a group of children where you might err on doing an sleep EEG, good quality sleep EEG, because one of the close mimic is what is called as Landau-Kleffner syndrome, where you may not have seizures externally, internally there might be a lot of seizures. And if you treat that as well, you can have a better speech outcome. But there are a lot of differences between these two. Autistic regression happens between 18 to 24 months, whereas Landau-Kleffner is generally around 4 years to 5 years of age. And some external seizures might be there. So EEG is something which we do in a group of children with neurodivergence where there is a autistic regression. So that is another testing.
You've given a lot of content for clinicians. Now I need it for the consumer.
1 minute, let me add to what
Yeah.
he said, because he's treating one child from my clinic only. There's one kid, I don't want to take the name, but then I hope this will be removed.
Yeah.
So, a lot of children who are not getting response to therapy, years of therapy has been done, and the kid is constantly at the same level, no matter how intensive the therapy is. We immediately refer them to you. I refer them to Dr. Lokesh Lingappa because I trust his diagnosis, and we actually find that they have subclinical seizures, which can be only identified in a sleep EEG. And then he starts medication, and the results will start for therapy.
Got it.
Yeah.
Got it. Okay. So, just one of the last questions. How do you differentiate between dyslexia, ADHD, and autism?
Okay, I think Dr. Deepthi will be better to answer that.
Okay, so in a simple term for the parent to understand, autism is a predominantly social communication deficit. Intelligence is not the criteria. For ID, intellectual disability, poor cognitive skills are the major thing. For an ADHD kids, it is not the cognitive skills or the social communication, but it's the attention and focus and impulsive behavior. So control on their own emotions or emotional regulation is the main challenge. And coming to dyslexia, that is slightly separate, where a perfectly normal looking child, otherwise very good in every other aspect, whether it is speech or social communication or even arts or athletics, but facing a huge amount of challenges in reading and writing skills. Despite these three, there is motivation, there is perfect training, and there is also all the support that is given to him with normal intelligence. But he's finding reading, writing really difficult. Even at the age of maybe 8 or 9, small spellings are also a big challenge for him, not because of his low intelligence or not because of his low motivation or training, but genuinely because the problem in the processing of the heard language or words, breaking them into syllables and then writing. So dyslexia is something slightly different and usually diagnosed only above the age of 7. Below that we can only say at risk, but we can't really say dyslexic. 7, at least 8. Then we can say this.
I was also very curious to understand dyslexia because I was one.
Oh, really?
So I was a dyslexic student. So that is what made me ask you this question, because for me, when I started reading about the ASD, I thought that dyslexia or ADHD is also on the spectrum. Just to understand that this is a very different subject, right? And then ADHD is extremely different, and then
you could have comorbidities, like a typical diagnosis, primary diagnosis is autism spectrum disorder, but 1/3 of them can also have a comorbid ADHD. Very difficult to control despite all the therapies going on, everything is taken care of. Still, the impulsivity is very high.
Sure.
And all the time they are like throwing things or pulling things and all that. But that is 1/3 of it. Dyslexia is something completely different, but ADHD and dyslexia again can co-occur.
Got it. Got it.
And most of the dyslexics are mislabeled as ADHD.
Got it. Okay.
The creature only complains that he lacks attention. That is translated to ADHD, but it is not as simple as that.
Got it. I think,
I'm good.
Yeah.
Thank you. Thank you.
Thank you, Dr.
Thank you,
Lokesh.
sir. Yeah.
Bye-bye.
Bye.
See you.
Bye.
Dr. Lokesh had to leave because he had some prior commitments. So we'll continue from where he left. I would have a question for you, Dr. Madhavi. Is leucovorin alone sufficient to bring about meaningful functional improvement, or how does it work in combination with therapy?
Even after the child is diagnosed with, FRAT positive child, put on leucovorin, is not going to magically, improve or grow out of autism, so to say. That's not the treatment or cure for autism. A lot of people, after listening to Trump's talk about autism treatment, like they found some cure for autism or treatment for autism, they suddenly woke up to this fact that, oh, there is a medicine that's been now found as a treatment for autism. We get a lot of calls asking us, do you do the autism treatment? Then we have to have a doctor involved and then testing and all that happens. But that's not a treatment for autism. That's one of the things that parents have to do to find out if the child is FRAT positive and then continue therapy. The outcomes of therapy will improve if there is a child who has this deficiency, and then you address it along with therapy. It is not a fix or a treatment on its own. It cannot be done in isolation. So that's important that parents need to understand that. And not all children are FRAT positive. Not all children with autism are FRAT positive. Only after the testing, your doctor will tell you if the child is FRAT positive. Then the treatment will be started by a doctor and the therapies need to continue. There is no way that the child can stop therapies and still get, help with only the medication or leucovorin.
To that leucovorin question, my question is for you, Dr. Deepthi. How do you administer the leucovorin treatment overall? I mean, we've spoken about, you are seeing changes in about 3 to 4 months. But as a clinician, as a pediatrician, how do you see and administer this leucovorin treatment in your patients?
So basically it comes in a tablet format. It was being used almost like 80-90 years, since 80-90 years for cancer treatment, as a part of cancer treatment. When the cells, when you give chemotherapy, even your normal cells get lysed. So for their regeneration, we were using folinic acid way back from 1950, if the history goes like that. It comes in a tablet format. It is easy to administer either with water or they can swallow it. But if you're asking me the dosing part of it, like we were discussing previously, it has side effects of irritability, sleep disturbance, hyperactivity. So we always start low. And we are also starting only in those cases who are showing biochemical evidence of this folate pathway deficiency. Gradually, we increased every week, step up by about 5 mg per day, 0.5 mg per day. Per kg, and highest dose documented is 2 milligrams per kg per day, which comes roughly around 50 to higher is like 60 mg. But like I have to say it on this show that this is not FDA approved as such. So if a parent comes tomorrow and questions you, my child worsened after leucovorin, is it an approved treatment? It is not yet approved. Even in US, it is not yet approved. It is still in the process. So when the parent comes to us, we are doing the testing, but we are giving them the disclaimer that this is not yet FDA approved. You understand the pros and consequences of it. If you are willing to go through the trial, we could do it. Still under research, we can consider.
Okay. My next question would be for you, Dr. Sita. King's College London says IVF for male infertility is directly linked to increased risk of intellectual disability and autism in children. Do you agree?
So as I said before, there's no direct causal relationship. So male infertility is more if the paternal age is more. So autism is linked to advanced paternal age rather than male infertility alone. So nowadays what is happening is late marriages, and because of career constraints, they are planning kids at a later age. So that is actually increasing the risk of male infertility and even autism when they are taking fertility treatments. But there's no direct causal relationship.
Okay. Dr. Amita, my next question would be for you. I have a friend in her mid-30s who is currently pregnant and has also briefly spoken to you. Does maternal age also have a real association with fetal developmental delays, or is it mostly a misconception?
I wouldn't dismiss it as a misconception. As the woman ages, basically her eggs and the chromosomes in the eggs are also aging. So the incidence of chromosomal abnormalities increases. So that is the same logic where we do the testing for Down syndrome in women who are beyond 35 years or so. So as the age of the mother increases, the risk of chromosomal abnormalities increases. But I wouldn't really pin that down to autism. It is much more common when we look at things like, say, Down syndrome or any other chromosomal abnormality rather than autism per se. So there's a little difference there. Both are children who have developmental, or intellectual issues, but they are very different.
Got it. And just to add on to that question, for people, let's say, and women who are conceiving after 35, do you recommend a FRAT test for them?
As a routine, I probably would not, especially if it is a first-time mother, because as she said, the treatment is not yet FDA approved. My protocol there would be probably to insist on the preconceptional folic acid. And if we have a situation where we feel that the folic acid is not being used, say she goes in for an early miscarriage or has complications with the placental development, for the next pregnancy, I would probably suggest it, but not straight off as an investigation in the first pregnancy itself.
But I've
To add on, they say 10% of a normal population has these antibodies. I mean, out of 100 people here, if you send all our samples, 10% would be positive. Now, that doesn't translate to real functional deficiency. And we really don't know, like, how do we identify? There is only one way, is that in the CSF, our cerebrospinal fluid, if the tetrahydrofolate levels are low, that is the only thing which is telling you clearly that yes, this pathway is defective. But it is impossible for us to collect the CSF of every person and check. Even those on the spectrum, it is hugely difficult. And the labs are also, right now, we are not in a position where we can check those molecules. They are being done in few European countries under studies. So that could be the marker then. Like if a child has developmental delay and you are attributing it to folate deficiency only, then the only specific marker can be CSF methyl tetrahydrofolate level, which is as of now very difficult to measure.
So adding on to what you said, so if a couple decides to have a child, is it better that, from the time they decide to have a child, they get all their general, health markers tests done, like all their levels tested, including homocysteine. Nowadays, I'm seeing really high homocysteine in very, very young people, like my nephews and all. So I just think that generally, if they address those issues and then conceive, that itself could be a good step towards avoiding
the
certain
periconceptional
issues.
counseling.
Yes.
There we can probably look at folate levels.
Yeah.
We can look at, now we by default we look for vitamin D levels and we're looking at iron. This can be part of the evaluation there.
Yeah. I feel that young mothers don't even know that they need to get some tests done because they think they're young and everything will be all right, and why would they have any deficiencies? Because of our modern lifestyles and the kind of day, we are mostly sitting in front of a computer and working, it might be causing disruptions in various things. I think once they test and then conceive a child, I think that itself is half the problem solved for us.
Young mothers don't even know that they have to take folate preconceptionally. Most of them think that they have to take folic acid after they conceive. So even the most educated ones, they don't know that folic acid has to be taken 3 months prior to conception, not after conceiving. So that will also, this awareness is also very important in preventing any neural tube defects in the baby.
But to add to that, if you see way before, like 2000, or maybe 1980s and before, nobody probably took folic acid. But the autism risk was so low. So these are not to be directly correlated as of now. Then the nutritional deficiency was so high, nobody took supplementation, yet the autism risk was barely there. 1 in maybe 1,000 kids had autism. Now the risk is 1 in 35. 1 in 35. 3% is a risk.
Maybe that's a diet change can be attributed
There's
to
so
that.
many factors to that, not one thing. So not directly relating folate alone as a risk of autism. We need to be very clear that it is maybe one of the factors, that's all.
But there I would say, like at that earlier when they were not taking folic acid, your incidence of
Neural
neural
tube
tube
was very
defects and
high.
congenital heart diseases
Yes,
was
yes.
much higher.
Yes, yes.
So it helps in those aspects. So
Yeah,
it is
structurally
very
proven.
important. And the thing is, the most of our women, they come to the doctor like they miss their period, they wait for another week or 10 days, make sure that they're really pregnant, and then come to the doctor.
Yeah.
Which means she's almost like 30-40 days after her last period. By which time the formation of the neural tube is almost complete. By supplementing folic acid after that, we are not really doing much. The important, the crucial period is already complete.
Yeah, yeah. And here I would want to add a story of how me and my best friend, we both sort of conceived at the same time. While she was in the US, it was also well planned, She started this 3 month earlier, understanding around the thyroid level, sugar levels, etc. And primarily, I was the one who was pregnant. And like you said, the 30-40 days after, I realized. And, of course, my obstetrician was absolutely very, very subtle about it. But she did indicate what you are saying, about the folic acid and how, this should have been planned in a way where all your biomarkers were checked before. But I think even with a lot of us who have, kind of knowledge and access to all of this information, we are still in that zone where we are not planning it well. But basis this discussion today, I feel planning the pregnancy is also extremely important, as much as the pedigree analysis of both the husband-wife is important, right? So, those are the tests and those are the diagnoses that we now need to start doing. So as, we have more importantly, brighter children, as well as, I think, healthier child is the aim of this, right? I think one of my questions for you would be, Dr. Deepthi, how does the diet and medication of neurodivergent child differ from that of a neurotypical child?
Medication in the sense?
Medication, diet in general. In general.
Okay. So coming to medication, if it's for a general illness, it doesn't really change much. Try to avoid antibiotics as much as possible because their gut flora will be disturbed and these kids are really sensitive to the changes. So if there is a real need, obviously you'll take it, but don't take it for every cold, cough or small minor loose stools or vomitings kind of things. Coming to other medications, if you are asking, there are certain FDA approved medications which we selectively use in only those kids of autism in whom the other issues are very prominent, like a lot of stimming is there, lot of sensory issues, extreme irritability, extreme restlessness, unable to control despite all the therapies and all, extreme sleep disturbances, or self-harm or harming others, biting and all. Then we can use certain medications like risperidone, aripiprazole. They are FDA approved. From as young as 4 years we can start them depending on the need. And if they have some comorbid ADHD kind of picture and it is certified by a proper psychologist and all, beyond the age of 6 years and all, we could try some ADHD medications as an add-on, like methylphenidate, etamoxetine, but not to be tried on their own at any cost or over the counter, we cannot give them. Diet is like, it is again debatable. I think Madhavi will be more pro for the gluten-free, casein-free diet. But by and large, if I have to say, the class of evidence is weak as yet. We classify the evidence as class 1, class 2, class 3, class 4. Diet is falling under class 3 evidence. That means few have reported some positive changes, but if you take overall meta-analysis, did diet really change the outcome or the trajectory of the children with autism? It is only class 3 evidence. But having said that, I would tell the parents definitely, if they have gut issues, like lot of loose stools or bloating or pain abdomen, crankiness, no explanation and they have vomitings and all this kind, or undernourished, then you can go for a trial of gluten-free, casein-free diet with the idea that try for 3 to 6 months properly, see the results. If you are really convinced the child has improved in a lot of aspects, you can continue that. If not, you can pretty much go back to the diet, because nutritional deficiencies are a huge challenge. If you completely remove everything from the diet and then you're only putting in only this rice and other things. And there's a lot of misconception about fruits and autism. They're no way directly related. Again, as a part of trial, if you want to try 1 or 2 fruits which have high content of sugar, you could do probably. But by and large, fruits and vegetables can be consumed normally. because they are a good source of vitamins and minerals. And also constipation, which is very commonly seen in these kids. One reason is that they are avoiding everything else, fruits, vegetables and all, and only going to with simple carbohydrate diet.
Got it.
But she would probably add on, because way back she was the first person to counsel me about gut dysbiosis.
Yeah,
10
because
years.
I did read that autism and gut
Yes,
are directly
directly
related.
related.
You know?
She could probably
I wouldn't
answer.
say, yeah, absolutely. I believe a lot in food as medicine for children, especially before we actually give any other medicine to help with any other things. Like, I literally traveled the world with my son to help him way back 25 years ago. He's 27 now. So when he was diagnosed at 2, it is around 2000. Around 2000 is when my journey with autism started. And I found a doctor in Scotland and I had to go there. And she is the one who actually told me about gut dysbiosis, where the whole world was not even talking. She was doing some research and she said that, yeah, I'll help you. And when we did all the testing, we found out that Varun's entire, vitamin and mineral levels were all over the place, and his gut was completely, messed up. We had to address it. So my journey started then, and from then I've been reading. I've been obsessed with gut as one thing that I work with every child who comes to Ananya. That's why I might have told. I don't recall that at all now. But what happens is, our children, autism per se is a condition where children become fixated to certain foods. Okay, parent wants to give them everything, but our children will pick only a few foods and they just get fixated to them. So some of our children were drinking up to 3 liters of milk a day, not eating any other food, or maybe eating little bit of roti or biscuit or something like that. That's it. That means they have no fiber, no other carbs also, not even rice. And that means that parents hands are tied. The child is just, so parents wants to keep the child alive, right? They have to eat or drink something. So mother is okay to just keep on giving the child milk. So they're highly constipated because all that they're having in a day is just milk.
Yeah.
Okay. And or children are just picking 1 or 2 things and eating. They're just eating rice and potatoes. So aloo fry and rice. Aloo fry and rice for breakfast, lunch, dinner, snack, everything is aloo fry. French fries. I've had children who are only having pizza for breakfast and lunch and dinner. That too margarita pizza.
Wow.
That too from one particular place, So our kids are obsessed with these detail. They're heavily detail oriented. Parents are panicking that, at least I have to give him some food.
Yeah.
Then that will mess up the gut. Even if I do that, you do that, it will mess up our gut also.
Absolutely.
Right? So it's not related to gut. So what we tell them is, when we eliminate milk and wheat from the diet for a child, that means we're basically eliminating all the junk foods. That's my first thing. So when I tell parents to go off gluten and casein, they can't have burgers, they can't have pizzas, they can't have biscuits, they can't basically have any junk food. It's impossible to have junk food without milk. And so that's my first thing. Then we have a very senior nutritionist, Dr. Shruti. She works with them and we do all the testing for them to see if there is any allergies or, intolerances of foods. So then the parents will even consider other items to feed them. Okay. Once a test comes positive, we send the test, and then any test comes positive, then we do elimination in a very scientific way. We don't eliminate everything in one go. We eliminate one thing that is causing the most harm for the child. Then because with 2-year-olds, you can't eliminate whatever they are eating. It's impossible to keep them feeding something, right? So if over a period of time, when we introduce all the supplementation and probiotics and everything, then we reintroduce the foods to see if the child is able to tolerate the food that was causing harm. Then we do the testing. It should be done scientifically. Nowadays, what happens with mothers with WhatsApp groups and these
Google and
social
now
media,
ChatGPT added.
they are just saying, sub eliminate kar do, GF, CF, SF, this F, that F, everything gone. It's not like that. You need to know which one is your child not tolerating. Go to a doctor, go to a nutritionist, do it under supervision, not on your own. So I totally agree that gut plays a major role. And my experience comes with my own lived journey with my son. My son's complete U-turn happened with gut. He wasn't gaining weight. He was no attention, non-verbal till 6 years. From 6 years, his trajectory completely changed. I think we could heal many things with supplements, and then only, FRAT in a way is a blessing in disguise for me. because now parents are open to testing. Earlier, when I would ask them to test, they would say, but what testing will you do for autism? Now with FRAT coming, we can also add in a few more tests to check how are the other levels for the child. We have seen children with insulin resistance because they are on high sugar diets, 2-year-olds, you know. It's crazy. We all kinds of, we have about 300 to 400 reports I should discuss with Dr. Deep. We should publish something because the kind of findings that we have done in 3-year-olds is mind-boggling because of the kind of food they are eating. You know, it takes years to heal their guts.
So to put it simply, what we can counsel a first-time parent who is coming and he has been diagnosed autism, don't go for all these elimination diet straight off. Cut down the milk to maybe 300 to 400 ml. That is more than enough for the calcium. Don't go for any bakery products or processed foods. Definitely home-cooked foods, normal natural home food. Fruits and vegetables are completely fine. If possible, opt for a organic, like grown ones, if possible. If financially they are okay, they can opt for that. And a lot of, like 40% of the food can be vegetables and other things. Maybe carbohydrates, you can cut down little. This much we tell them. Rest, I think we should be following them, what happens to them, how is their behavior, and then decide. Yeah.
And children who are not chewing cannot have vegetables and fruits. That's another reason that parents are not able to feed them vegetables. Even beans, if you steam and give them, even smaller pieces, they don't know how to manage that in their mouth. They're gagging because they've never eaten any other textured food except soft rice with some dal or something. Just boiled dal, soft rice, ghee in Telugu families, curd rice, dal rice is a go-to. If a child is not eating, at least give papanam, give peruganam, okay? Now with vegetables, even little bit of fiber that comes, they are able to sense that little fiber. Even if you mash a carrot and put it in the dal rice, they're gagging. They're not even swallowing that food. They don't know how to handle that texture in their mouth. So with oral motor therapy, with slowly introducing different textures of foods into their life, it is taking about 2 years for us to introduce, make them chew.
Wow.
Make them chew. And a child, if he doesn't chew till 6 years, they are unlikely to chew after 6 years because it's not possible to train them to chew after 6 years. So children are coming to me at 7 years, not chewing, eating soft food. The kind of cases that we see nowadays, I have not seen in the last 25 years what I've seen in last 5 years. It's another, as if the world has completely taken a U-turn now, post-COVID, because of the screen addictions and children not getting out of their houses. They're not even aware of chewing. Have you ever heard that? You will be shocked. I don't want to scare by talking about some cases, but I have seen quite extreme cases of children with food issues.
No, what has happened is because of digital and social, everything seems to be very cool. What you're saying, I saw a video where this parent was making puree of almost everything possible and actually storing and freezing it. And then very, kind of coolly showcasing it on digital and social media. And people were actually rejoicing it, stating that this child is only having popsicles or, kind of only having all these stews, etc. Now I realize that it's not the right way to do it, So rather than celebration, it's like a red flag, where we are not able to understand and we are rather making it a normal way or a different way of, the upbringing that we are doing.
Our children have to grow up and go off to colleges, go off to parties, have a good social life and eat everything, right? Food is one of the most pleasurable things that a human does in their life, right? If you imagine a child not able to chew, cannot eat most of the foods that are available for them throughout their adult life, you're basically making them disabled in a different way.
Yeah.
Right? They don't imagine if you have a child with cerebral palsy with lot of motor issues, they won't be able to eat most of the foods and they have to be given pureed foods, and that becomes a major issue for them, they'll have constipation, so many other issues because of that, right? Imagine a typically developing child or a child on autism spectrum. They don't have any motor issues at all, but we are just allowing them to not eat by pureeing them or all kinds of things we are giving. That's not a solution. You have to make sure the child eats. And the parents are nowadays so cool about saying, it's okay, I'm fine. It's not about you being fine. If a child is not walking, are you going to buy him a state-of-the-art wheelchair? Because he doesn't want to move. So you're going to gift him a wheelchair for his 16th birthday. If you're not going to do that, you can't say these things. I feel it's a kind of child abuse that we do to children. We don't even think that it's abuse, but it is abuse. If you're denying them opportunities to try different foods, clean their room on their own, make their bed on their own, do their own work, learn. Life skills are as important as education. I know of many 16-year-olds who don't even know how to make their bed.
I'm very sure.
Yeah, they have helpers.
They have helpers, and
Yeah.
I think it was never instilled to them.
Yeah.
Rather, I think life skill is a very important subject that I think should be introduced at the very formative years of school, where these things should be taught to you,
Yeah, 16-year-olds.
And then food, cooking of food,
Yeah.
specifically for men in India,
Yeah.
it should be a life skill that should be taught to almost everybody, across the board.
Yeah.
So I think my next question would be for you, Dr. Sita. I think India is right now like a gas chamber across, I come from Delhi, so I'm in the extreme chamber of the country. How important is this pollution and pregnancy, or the issues related to pregnancy, becoming I would say, marker for you when you are seeing IVF cases?
This is a very significant marker because the rate, even there are some studies which say that the rate of infertility is more in states in which the air quality index is very poor. Delhi sees more infertility cases when compared to southern states. So this has been studied, and pollution has been linked to decreased ovarian reserve and the egg quality being poor. Even the surroundings which we stay, even in our state, there are some districts where the infertility risk is high, especially where there are coal mines or where there are this mining activities which happen. So there the risk of infertility is high. Where there are some districts where tobacco plantations are high, or these mining activities. So definitely this plays a role in the risk of infertility. And even there are some studies which say that this plays a role in even preterm births also. The air quality also plays a role in preterm births. And even for male fertility, this plays a role. Yes.
Got it. Dr. Amita, at what stage of fetal development, according to your expertise, does the autism begin?
See, one thing is, when we are looking at the fetus when the baby is in the womb, one way of doing it is using ultrasound. Another way is doing the genetic tests. Now, these are things that are looking at the structures of the baby, but they are not really looking at the functioning of the mind. And autism is something which is related to the higher functions, like it's intellectual, it is your emotional quotient, your IQ, and all of that. And when a baby is born, we can't really assess any of it. When the baby is in the womb, there is even less chances of us trying to assess it. It's like looking at a car in a showroom. We are looking at the structures, we are looking at the structure of the brain, the parts of the brain. But is this child going to be able to do math? Is this child going to be able to speak? Is something that we can't really evaluate or score when the mother is pregnant. So that is something that is still very much a gray zone. The best we can do is look at the development appropriate structurally for that period of gestation. So we are, our hands are tied at that point.
But I've read about this, that in cases of preeclampsia or gestational diabetes, the risk tends to become a lot more.
The risk, say for example, if it is a preeclamptic mother, the mother is having hypertension. So in turn, the amount of blood supply, the placental function, all of that is compromised. And these preeclamptic mothers are a lot of mothers who have this folic acid deficiencies. So these all kind of play a part. It's multifactorial, like how we spoke. And though we can't really quantify it, it is something that marginally increases the final risk. So they increase the risk of autism because of various other factors. It's not just because of one particular condition.
So to add on to your question, like you asked, like how early can we pick up, if I have to translate? Is it in a 2-month baby can you pick, or is it in a 6-month baby can you pick? Maximum out of all the, if you take 100 kids of autism, 99% have reported that they were pretty much fine based on their video evidences also before the age of 6 to 9 months. It is when the brain is actually growing so rapidly and forming new connections, which happens in the first 2 years of life, they are seeing that it is getting slowed down. and in some cases even regressing. That is what is called autistic regression, which Dr. Lokesh was talking. So 1/3 of the cases of autism will clearly report that this child was talking at least 20 words, calling people by name like tata, mama. He was waving a little bye. He was trying to clap. He was trying to look into our face and laugh and all that. And all that went off after the age of maybe 12 months to 18 months. And by the time 2 years, he has almost become like very passive to any of our and not reciprocating and all. But this happens in 1/3. In the 2/3, what happens is till about 6 to 9 months, they seem fairly good. They're playing peekaboo. They're smiling at us. Name call response was there. After that, it slowed down. It didn't go back, but they just remained there.
Yeah.
And then after 1.5 years, they have not attained anything new. So this is autism is something like a functioning of the growing brain, especially is at fault, not the structure. So testing in fetus is, I think, impossible. Testing even less than 6 months is pretty difficult. But now they are doing something like AI-assisted visual tracking. How these babies are following the faces or objects, and I think that research will come up in few more years, like by the age of 3 to 4 months, like the way we check the ears and the eyes, probably can we check the visual tracking of the kids. They are not focused on human faces and human expression, more towards objects. So maybe if we can pick up like that, it will be a early marker.
Got it. My question would be for you, Dr. Madhavi. Based on your long experience in this field, what changes do you often see in family dynamics once a family realizes their child is neurodivergent?
It could be some very small percentage of families are absolutely, they take it with calm and they're like, okay, now this is where we are. How do we address this? How do we help this child? Okay. And 80 to 90% of the families are totally thrown off because it doesn't fit into the scheme of things that they have planned for themselves. Like their life plan has been made and this diagnosis throws off. That means now mother has to stop everything, put her life on hold and focus on the child's development. So most of these mothers that I work with, because we are in West Hyderabad, most of these mothers are working mothers. 90% of them are working mothers and their career is just about to take off then, and that means they have to quit, and that really causes a lot of unhappiness and discomfort in them, because husband, usually at that age, the child needs the mother and father can actually continue to work and mother ends up not working. And the extended family, we are in India, right? In-laws and sisters-in-law and everyone becomes part of everything for us. Some of them, because we are in again Hyderabad, I see a lot of North Indian families that are in Hyderabad, they don't even disclose this to their families. They stop going to their hometowns they think that इस दिवाली नहीं जाएंगे, अगले दिवाली जाएंगे, क्योंकि जब तक मैं ठीक कर लूंगा बच्चे को, That's not the case we know that's not the case, but that's the story they want to tell themselves. And a lot of times the in-laws blame the mother. Mother is the scapegoat in the whole this thing. She is the reason why this child is born like this. She is the cause of this defective child you brought into. हमारे खानदान में ऐसा बच्चा कभी नहीं है. हम आपको लेके आए हमारे खानदान में और आप ऐसा बच्चा पैदा किए. That's the story that they want to believe in. And if the in-laws come to me, they keep on asking that ऐसे क्यों हुआ है, ऐसे क्यों होता है, ऐसा बच्चा क्यों पैदा होता है, and they want me to say because of some problem with the mother, which is not, nobody knows actually who's the primary cause for this condition, right? How can you be 100% certain? And as I told you offline, that in some cases they also want to get another bahu into the marriage to get a good quality child for their family. So the whole range, and the mother's mental health completely goes for a toss. There are no support systems in place, and in India the word mental health itself is a taboo. If I recommend a psychologist to a mother, because we don't work with adults, we always refer them to somebody outside. They would say, ma'am, I came to help me with my child. You don't need to tell me that I need fixing. I'm not saying you need fixing. I'm saying you need help. And a person, if you go to a psychologist or a counselor, will be somebody that you can talk to without being judged. You can't talk to your neighbor about your autistic child. You're not even ready to talk to anybody about your autistic child. And they're so worried, my sister-in-law will think that I've given a defective child. My mother-in-law is going to judge me. All financial implications, one salary stops. They would have just bought a new house. And I've had a family where they have a bought house in a foreign country. They wanted to relocate and everything was in place and their child is diagnosed with autism, you know. So it really is a tough time for the families. They need a lot of hand holding and support, not just the child. In fact, the parent needs more help. And they are looking for quick fixes. That's when they become very gullible and they fall prey to all magical treatments for autism that now have popped up everywhere in India. They'll say, "Aapka autism theek kar denge." I don't want to name the treatments, but they're quite dangerous because they waste the most critical 2-3 years of their life where therapies work. They try all the magic for 3 years. That means 2 years plus 3 years would be 5 years. They come back to us again at 5. By then, it's a pretty much one-way street for us. You have to only maintain the status quo. You don't see major improvements. Improvements. That's when they put pressure on therapy centers and say, now you need to help me. Now, okay, I'll do 6 sessions a day. It's a child. You can't abuse a child by doing 6 hours of therapy a day. Okay? You can still do only that much therapy. The child can only absorb that much in a day. But now they know it's only a 6-year window. Early intervention closes at 6 years. The window closes. Now they want to do another level of magical treatments. You know, that's when they, as she said, the FRAT window starts at 4 or 5. These are the parents who want quick fixes. I am very much for testing at 2. When a parent comes to me at 2 years, I would ask them to go to a doctor and get all the tests done. Why wait till 5? It doesn't cost some millions of dollars to do testing. It costs maybe a few, maybe 30-40K, 50K maximum. In India, still affordable. It's fine to spend that to ensure that the child does not have any other issues with health, you know, medical health. And if a medical practitioner is part of my team, I would be thrilled. That's the reason why I even agreed to be on this on the table and on the conversation. I feel that somebody like Dr. Deepthi and Dr. Lokesh Lingappa would be a great team member for me to ensure that those are eliminated for me so that the therapy outcomes are significantly higher for us. And even this kid with seizures, as I talked about, the moment Dr. Lingappa gave the medication, now the child is sitting and we are able to show some results to parents. Parents are frustrated, and these are a typical North Indian family that we've had with this child. The father is in complete denial that the child has autism. He calls it speech delay. In every meeting he says, "Ma'am, ये speech कब शुरू होगा? ये speech delay नहीं है, ये autism है, but वो मानने को तैयार नहीं है." You know? So it's very difficult for us. If that child, it took 2 years for me even to take out neurologist's name in the meetings. The father's like, there will be a meltdown in the meeting for us. You know, they're not ready. So we are literally treading on eggshells every day with these parents. They say, "Ma'am, autism word use mat karo. मुझे सुनना नहीं है वो word. This is not something that we are ready to even listen to that word. ये शायद नहीं है ma'am autism. शायद ठीक हो जाएगा." You know, all kinds of things. So I feel sorry for these parents who are not even doing the first line of treatment. Forget about medical testing. So we would want to start these testing for all the children who come.
In fact, you bring a very important point, Dr. Madhavi, and I'm very sure Dr. Sita and Dr. Amita will agree. Something around mental health. And and this is a very interesting study which says that FRAT also helps in depression and mental health, right? And I'm very sure you are into IVF and we've seen a lot of unhappy, you know, kind of couples around, because unfortunately today also fetal is being treated just for risky pregnancies, right? How do you see, you know, kind of mental health changing the game plan overall, specifically for autism or, you know, kind of for recurrent pregnancy losses? How do you see this all coming together?
Definitely mental health plays a role, not only in recurrent pregnancy loss, even for first pregnancy also mental health plays a role, because if the mothers are stressed because of different reasons, they are at a high risk of complications, preeclampsia, diabetes, or multiple other things. We are seeing a lot of rapid increase in gestational diabetes recently. Gestational diabetes was very less before, but recently gestational diabetes incidence, preeclampsia has increased. I don't know, maybe this stress is because of the career or because they have to manage alone, or now parents are actually stressed of even becoming pregnant also. So even planning pregnancy is also stressful. So for everybody there, I recommend a preconceptional counseling, and these tests should be done. They have to be prepared for what they are going to have in their life later, because as soon as they are pregnant, I see a lot of patients, they are panicking. How will I manage a child now? How no sleepless nights? That stress actually causes a detrimental effect later.
Yeah.
So preconceptional counseling and preconception testing is better. I would recommend this happens by a proper psychologist. Let them get counsel, but again, the people don't take it in a positive way. They feel that they are being, they are being treated as abnormal and all. But this is pretty normal. They should opt for preconception counseling by a proper psychologist. And even for unexplained miscarriages and all, they should be counseled, and they have to take it in a positive way. I would suggest a preconception counseling and testing for everybody. What do you?
I completely agree with you. I completely agree. And these women, see, basically when you are stressed out, what happens? Your cortisol levels are high.
Yeah.
So in turn, that affects the growth of the baby. That pushes the stress levels even higher. So yes, I completely agree with what Sita is saying. It definitely makes sense. And preconceptional counseling plays a very, very important role. And in our country, I think it's almost non-existent concept.
But where do I go for this pre-conceptional counseling?
Any obstetrician, as fetal medicine I do it, I'm sure as an IVF specialist she does it, any obstetrician does it. So it is just there. The people need to kind of approach them and ask them, what do we need?
And one more correction, it's just not the mother, even the father should go for counseling. Most of the times I just see that the father pushes the mother to go for counseling because it's your responsibility to take care of the kid or, go through pregnancy and all. It's not like that. The couple has to come together because the father also has to prepare on how to handle his wife during pregnancy and post-pregnancy because they go through a lot of mood changes. Lot of people have lot of clashes during pregnancy because of which the mother gets stressed out. This again will impact. So even after childbirth, I think even if there is a neurodevelopmental child also, the father also should go for counseling. It should be a team approach. It's just not the mother's responsibility or the mother's family responsibility. So I would suggest this counseling should start from preconception. It should go through conception, even post-delivery. Even if there is something in the kid, any other defect in the kid, the father and the mother should go for counseling, and first they should be right to take care of the kid. But they don't accept that, they need counseling. They act as if they're very strong because they don't want to show their weakness. But I think there's nothing wrong in going for counseling.
So to add to this, because this mental health in parents is a huge concern, what Madhavi was saying was about the interfamily relation, how is it going on, blame game and all. But even for one single person, even though it is an extremely supportive family, they will go through a grief cycle. Because this is something that has happened out of the blue. They thought this child was perfectly normal. It is not like he was born with a defect and okay, there is no hand, then okay, they'll cry for maybe 1 month, but after that they get adjusted. Okay, this hand is not there, we'll do. But this is something like out of the blue, this diagnosis came like autism. So the grief cycle, every parent has to go through. It goes in steps. The first step is denial without doubt. Hardly there would be 1 or 2% of parents who are like, even if you say autism, fine. I have seen like that, but it's rare. They will be in denial for at least 3 to 4 months. This may not be autism. Maybe the doctor has wrongly diagnosed. Maybe the child was not cooperative that day and all this. But after that, they'll enter into a phase of either neutral or anger. And they might be really angry with everybody around. The family also, the therapists, everybody. Then they'll come to a phase which is called the bargaining phase, where they're like, okay, we accept the diagnosis, but probably it will improve if I do something. Should I try that Ayurvedic? Should I try this Homeo? Shall I tie it to? Shall I do that puja? This is all that bargaining phase which goes on. Only then they move on to something called acceptance, where they know that, okay, this is neurodivergence. This is how the child is going to be. Now let's accept, and next comes the hope. But now which parent will cross this cycle in how many months is completely different. One parent can do it in just 6 months with good support. The other parent Never. I have seen parent with autistic kid even at the age of 13, 14 coming and saying, this is ADHD, no, please tell us it's ADHD. So 10 years have gone, you have not accepted the diagnosis. And the huge problem is if both the parents are not in sync with the diagnosis. That is a huge problem. Mother knows there is something wrong, but none of the family is letting her even go to the doctor and tell. Many a times it happens, and parents do message, or when they are talking personally, they break down and they tell, we even tried of suicide sometimes. This is really sad, because autism is not something like an emergency to deal with. Nothing is going to happen to your child. But if the counseling all the time is like, this is like a terror, horror, like something is going to happen to your child, maximum, unfortunately, 90% of the counseling is like that. Whether it is from medical professionals, whether it is from therapists, ये बच्चा तो ऐसा रहेगा. You have to do this. Nobody is talking about the positive side. This is not like some emergency kidney disease that the child will die in 2 years, or some cancer or something like that. This is a slowly improving problem. And I tell everybody when they tell about that window, the window will close, the window. There's no window that is going to close. You take it as early as possible. But even after 6 years, huge improvements will come. That doesn't mean wait till 6 years. Come as early, but don't be in this thing that after 6 years this child is not going to do anything. Actually, a typical autism child starts improving at the age of 4, 4.5. Till then they are so passive. Maybe we can train on the cognitive skills and all, but communication usually starts after that. So if you can talk to them in a positive way, the way they look at their own kid will differ. But now how many have that patience and time to sit in the OPD or in the counseling and talk? So I think it's a collective responsibility of all of us to not to showcase autism as like a booth is there, something will happen to your child. It's fine, he has autism, but the potential varies from child to child, and let's see what best we can do. And I always show the videos of kids who have improved, so that at least the parent will go out of the clinic with some hope and not despair. You can't show the other videos like, see, this child came at 5, he never improved so far, then the parent is completely stressed out. I'll show them good videos. See, this child came last year, now this child is like this, let's try for this.
With that, can you and Madhavi help me with these inspiring stories of hope for children who are neurodivergent?
Like they have overcome, you're saying, or they just moved on and
they just moved on and they're now happy. Like I know, as a matter of fact, I mean, Madhavi as a parent has been talking about, kind of Varun a lot, right? How have you've been the 1%er that we all are talking about. But do you have anybody that you can sort of look at and say that this is an inspiring story for people with neurodivergent children?
The younger they start therapy, the faster they actually leave therapy centers. They will grow out of our need the earliest. That's where the window where we talk about early intervention. The later they come to us, the longer they stay with us. Simple. It's like any disease. The more it progresses, the longer it takes, or sometimes it doesn't, doesn't give the results that we want. So the children who come to me at 1.5 years are the children who actually improve significantly, and even by the time they're 2.5, 3 years, they probably won't even have ASD diagnosis, some of them, okay? And some of them might have ASD diagnosis, but a very low score of ASD, and they have a very good prognosis of being mainstreamed and going to a regular school and having a good quality of life. If a child comes to me at 6 years with autism diagnosis, and the parents were trying all the other treatments, Ayurvedic treatment, massages, the stem cell therapy is one more thing that very popular with parents. In spite of no studies being there that there is any evidence for stem cell therapy, especially for autism, still they would want to have a quick fix, okay? And after that they would come to us. Then the results are likewise, okay? And the results are latent. I mean, there is improvement. You may not see when a child comes to us at 1.5, 2 years, when we work, the results may not be visible. They start being visible at 4 or 5. That means there is no change happening in the brain. Okay, there are changes happening, but the results might show. Imagine a child coming at 6 years with autism, the behaviors are fixated, the patterns are fixated. Now we are fighting with the patterns to break the patterns. The child is only doing things in a certain way. The child wants to only play with certain toys. He's not at all willing. When a 1.5-year-old comes, if I remove the toy, he's more flexible to even explore other toys. It's not that they don't show that's why they're called at risk for ASD, because they are showing ASD like behaviors, but not full blown. Few behaviors. It's like a pre-diabetic versus a person who is already, where the diabetes is set in. Okay, pre-diabetics have more prognosis of growing out of the country or not even becoming diabetic if the parents take proactive steps. Likewise in our children also. I believe that there is a window, and this is scientific proof that there is a window.
I sorry if I have offended you on that.
No, I want to be clear on this because parents might think that I don't need to do anything.
No. I was very clear that the early you start, the changes you will see. But what I'm telling about the stress of the parents who are at around 5 to 6, they have taken therapies since 2. And now they are coming to us at 5 to 6. Doctor Saab, after 6 years, nothing is going to happen in autism. Is that the case? And they are tearing down and like broken and like they're saying, I'll commit suicide and all that. In that case, I'm telling that I'll be telling them in a positive way that the window is still open. I'm not saying do not act early. We are also taking kids as early as 1.5 years to 2 years, like she is saying. But one thing I would like to mention on this platform is the improvements in autism depend on 2 main factors. One is definitely early intervention, without any doubt. But the huge factor is cognitive levels, which is innate. From the same therapy center, from the same therapist, starting in the same age, 2 children with autism will not progress the same way. Because their cognitive capability will finally decide. That is what Dr. Lokesh was quoting. They did a study when they did all the scoring at 2 to 3 years and rechecked after 10 years. And the only factor which really mattered was how cognitively better the child was at 2 to 3 years. Interventions do have a role definitely for improving the functional capability and all these things, but the final outcome actually is the IQ, which is not in our hands. So whatever is in our hands is intervention. But I'm saying only give a positive statement to the parent, even if he comes at 8. I would still say there is a door, there is a window, we can work.
Yeah, absolutely.
And for us, autism needs pretty much lifelong approach to the condition. There is no therapy stopping. In some cases, there's lifelong. But my son, who's 27, he has a lot of social deficits. He still gets help from us. It's not that his therapy we have stopped. So brain is neuroplastic. There is no way we are saying that it's, even for me, if there is any deficits, even now I can, like when I go to the gym every day, I can't do some movements, and in a month's time, I move a way better, I do that exercise way better. That means my brain is learning new movements even at the age of 53. So what I'm trying to say is, yes, we definitely believe in neuroplasticity, but parents also shouldn't expect magical outcomes at 7 or 8. Autism to go away, the child should be going for IIT coaching when he's 15, when you start at 7. Those are unreasonable expectations to be put on any human being for that matter, not just the child, the therapist, the doctors. You know, we are under tremendous pressure to show results. And the results they want to see is what we have to show, not the results the child can give. You know, we have this expectation as a parent that, but I wanted these many words in 6 months. May not be as many words as you want, but the child has shown some improvement. So if the parents are happy to celebrate small wins, those are the parents who have less mental health issues. Those where the parents' expectations are going through the roof and the child is here, then you can't show results. They are likely to have mental health issues, all kinds of mental health problems they will have as a couple. And out of the 2 parents, one parent's expectations are there, and one parent is very realistic parent who's very grounded, usually mothers are very real, closer to reality because they are with the child every day. They know what to, but fathers are more numbers driven, analytic people, right? They will have an Excel sheet, especially IT fathers. They have an Excel sheet and they will say, over the last 3 years, I spent so many lakhs for therapy. The outcomes of the therapy are not proportionate to the money that I have spent. You know, those are the fathers that we are going to have a challenge with because their Excel sheets and the therapy outcomes don't match.
with that, I just feel neurotypical parents and neurodivergent kids' parents are the same.
Same,
You know,
same.
because everybody is expecting,
ROI.
you know, ROI driven,
child.
impact analysis. You know,
Yeah.
yes,
Yeah.
yes.
So like stress is when your expectations and your reality doesn't
Don't
match. That's
match.
it. That is what is stress. If you know what is the reality, if you can see what is the level of the child, accept the level. So sometimes we find a child who comes at even as early as 2.5, but very slow. Very slow. Even to make him do a simple task, it is challenging. Then we counsel the parents that this trajectory is going to be slow. Just don't expect that the same therapist doing the same hours of therapy that other child kind of improved in 1 year. Why is it not happening here? Because they're both, it's like simple like this. In a class of IIT or coaching, the teacher is the same. The teaching is the same.
Yes.
Now, does everybody get it? No, it
Yeah.
depends on the, of course the teacher is important, of course the training is important, but the reception level is also important. So if you set the, what do I say, expectations right, then stress will be low. The problem is if you give them a blanket advice like 1 hour, 1 year of therapy and you will see a different child, then the problem starts there.
I've seen that in twins. Twins, both of them have autism. One child improved significantly and the other did not improve. How would
Now,
you?
how do you?
Same
genetics.
parents, same household, same therapist, same number of hours of therapy, everything same, but the outcomes are completely different from for the same twins. I mean, it's identical twins. Even I can't tell them apart till they wear something different.
But to that question, I also had a question for you, Dr. Amita. You know, have you seen these cases where, you know, kind of in the fetal developmental or part of twins or triplets, one child had, you know, kind of autism and the other one was free of it?
Yes, we have actually. And it's not just autism, it is like any abnormality, there can be a variation. So if we look at twins, we have the, you know, so-called identical twins and the non-identical twins.
Yes.
Even though they are identical, meaning one zygote has split to form two babies. Basically, they're carrying the similar genetic material. Even they can be different. Even they can have different genetic abnormalities.
Wow.
So it is not, you know, nature is, you know, exception is the rule. So there are variations which we can't always, you know, explain by numbers.
I've seen twins, 2 boys, identical twins, non-identical twins, 1 boy, 1 girl, both autistic. And in cases where one boy is autistic, girl is non-autistic, where girl is autistic, boy is non-autistic. In last 25 years, I've seen all possible permutations and combinations. That's when I really respect nature. I surrender. I feel that no matter how much medical advancement has come, how much science has developed, there is some percentage that you cannot control. That's when acceptance and surrender plays a role. The faster you accept, the faster you surrender to the universe and accept that this is my future, this child is part of my life. What is the best thing that I can do going forward for my child as a parent with all my flaws and all my challenges is when you're going to have less difficulties with mental health issues. The more you're going to fight, the more you're going to say, I'm going to fight autism, I'm going to No, you don't have to fight autism. You don't have to overcome autism. Autism is not cancer or some deadly disease that you are fighting. It's neurodiversity. Rejoice your child's neurodiversity. Accept love, unconditionally. This is your path now. The faster you accept this course of your life, the happier you're going to be, is what I have seen. That's what I learn every day when I see Varun and Pranav. Pranav is a doctor. Varun is Varun with his autism and he's training to be a musician. Both are different. I can't make Pranav into Varun. I can't make Varun into Pranav. In fact, I have seen Pranav wanting to be like Varun most of the time. Why is he gifted? Why can he do things easily? Why am I going to school? Why is he not going to school? Why are you homeschooling him? Why do I have to go for NEET coaching? I be intelligent? Varun has eidetic memory. You give him a book, he can learn. Pranav is absolutely normal. No eidetic memory. He was like, why am I not as smart as Varun? So that was a challenge I faced in my household. So we all go through as parent challenges, right? Even if I had 2 neurotypical children, they would have been completely different individuals.
Yeah.
We are not supposed to compare any children for that matter, whether they're neurotypical. The biggest challenge I face in my centers is mothers sitting and waiting for the session to be completed and constantly comparing their children. That is going to cause a lot of stress to them. Why are you they're not even your children. They started therapy on the same day. Your child is doing this. I get a headache telling them, don't compare, don't discuss. I said, read a book, listen to a podcast, go for a walk, get a massage, do something. But don't sit and talk about your two children and compare them constantly. That's only going to increase your stress levels, isn't it?
Yeah.
Like we do.
Yeah.
Constantly I'm comparing to all 53-year-olds. My stress is going to increase.
Yeah.
It's difficult.
Yeah. So what I actually understand is basically in early intervention really helps,
Yes.
Therapy, your diagnosis, your medicines, etc. all play a vital role. And I think diet, as we go back, nutrition is extremely important in all of this. Supplements came out as a very important part from what I could understand in my, kind of pregnancy chapter. It is extremely important. And then mental health, as they would say, that ends and brings us to the, I would say, conclusion of this. Thank you so much, all of you, for coming on board and helping us to throw some light on a very important topic, which is autism. Now we are, of course, going to be pushing FRAT, etc. But the idea was to understand autism and throw some real understanding from people who are working on it as clinicians. Thank you so much. Bye-bye. Thank you.
You should do if at all you do another one like this, you should do one with somebody who works on, I know a psychiatrist who works exclusively with women, especially postpartum and any other. That needs to be talked about. In India, we don't even think that it exists.
Yeah.
It's such a common thing that women go through and nobody does anything about it.
Postpartum depression.
Postpartum is very important. And all these challenges happen also because of postpartum mothers neglecting their children. Not all in all cases, but in some cases when we take the history, then we understand, oh my God, she must be going through postpartum and she never got help. That's why she gave a screen to the
It's
child.
mainly awareness.
Yeah.
It's especially the family awareness.
Yeah.
They making her a villain, they're not treating it normal. Normalizing things, normalizing autism or normalizing depression or normalizing postpartum depression.
Yeah.
See, a child might have, my sister's child has childhood diabetes, type 1 diabetes. They're fine with it. So it's just like normalizing. So if we have an autistic child, we should be fine with it. Or if we have an ADHD child, we should be fine with it. Or we have a postpartum mother, we should be fine with it.
Yeah.
And see how we overcome. I have seen multiple cases where the family abandons the mother because she has postpartum depression. But that's the time where they need them the most.
Yeah.
Even if there is a troubled child, family abandons them. They don't call for functions or something. But that's the time they need their support.
And most of the time, the postpartum psychosis, everything is because of that lack of the support system itself.
It worsens, right? It spirals into a bigger problem.
Yeah.
In our experience, divorce rate is very high. in autism.
Divorce rate.
Out of 50 kids that we are having in a
Husbands
center,
not at all coming home, having
around 6
affairs
kids
outside.
had divorce.
Very common. Because they are running away from the problem, because coming home reminds them of the challenges that they cannot solve. And men are typically problem solvers. They want a problem to solve. You give them a problem, they are very happy to solve. They want damsels in distress, that's why, right? They want a problem to solve. So if there is a problem that they cannot solve,
They seek for another.
they are going to find other problems to solve or create problems so that they can solve them. I see fathers, they don't come for meetings at all. They don't come, and mothers are saying, ma'am, my husband is not willing to come. Suddenly he'll have a last minute meeting. I tell them, Zoom mein join karo, no?
Even postpartum depression, the divorce rates are high because they think that the mother is, mentally, and
Yes, that's
the child also will become like her. So it's better we have another wife who is normal and have a normal child.
Yeah. Yes.
No, but
and when I'm sitting in consultation in front of mother, father and child, I see father all ASD, high functioning behaviors. Father, no eye contact, not. I'm like, फादर को HF है यार, इसका डायग्नोसिस नहीं हुआ, ये बच्चा पैदा कर लिया, इसको भी शुरू प्रॉब्लम. And I tell, and after, on purpose, the mother will leave the bag in the consultation room and walk out of the consultation room and comes back just to have a word. Ma'am, you saw my husband. Did you see there was a problem? I said, yes, there is a problem with your husband. Never got addressed. The problem never got addressed, So I see so many. I should write a book.
Yeah.
With all my stories.
Very interesting, yes.
Very, very interesting stories I have seen in my life. And fathers, after that also, they are not willing to get a diagnosis or get any help for that matter.
While we are discussing stories, you asked about inspiring stories, right? So, like, we do meet a lot of parents, especially mothers, and I try to ask their little bit of personal journey also. How is the family and everything? So, this mother came alone from all the way from around 200 kilometers with nobody else, only that child, which is very rare. Usually, they come with one another, either father or grandfather or somebody. She said, I came alone. Then after the whole thing, I saw that the child was quite good cognitively, solving all the puzzles and all that. Social interaction was less, with few symptoms of autism, but not like full-fledged this thing. Then I just asked her like how much was the screen times. So as I expected, she said like 7 to 8 hours. Then I was like, but didn't you know like it can cause the problem? Then she's like, madam, that time my husband died during COVID. So I was in complete depression. So I had to give screen. I didn't even know that this child is like, what is he doing? I was in my own zone. Then I asked, okay, I am sorry, but then you could have given to your either mother or somebody else, right? She said, you won't believe, after 6 months, my mother expired due to COVID. And then I was like, then now who is there with you? Then she said, till a point my father-in-law was there. He was the only male member in the family. Me, my child and my father-in-law was living. And he expired with heart attack. No, I just couldn't, even today I get the goosebumps.
even
when
me, I am getting
I
the
was like
goosebumps.
shocked, like in a year, she had 3 deaths. Very normal family, low middle class. So I asked, what do you do? She said, I'm a blank employee, some clerk in the bank. So what is your timing? She said, I have to go at 9 till 6. She's the only breadwinner. Now she can't do anything. So where do you leave this child? She said, there is one good neighbor who said that, okay, they will take care of. So now I didn't stimulate the child in any which way. I said, nobody can probably in your case, like with 3 expired in COVID, with no financial independence. So I said, okay, no problem. I didn't like wanted to blame her for this like poor stimulation and all. I said, maybe you did the best you could do in that time. But I see a very positive hope, because despite all this poor environment, the child is not so rigid. He's playing on his own and all, but he's still not very rigid. And I gave her a home plan and all. I asked, can you afford therapy? She said no, because she's a single parent. Okay, I said, we'll give a home plan, you try on your own. And very surprisingly, after 1 year, she comes to the OPD getting the child. Now the child is talking in sentences. There is no particular therapy that went on. It is just that interaction with the parent, she improved. Anganwadi she was sending, whatever is a government school she was sending. And she kind of understood what to do with this child. So she came to our one another parent session and she spoke on stage also, and literally everybody was in tears. When compared to mothers like this, I think we are all so fortunate. At least you can afford therapies, you can afford medicines, you can afford a good lifestyle. Nobody in the family, and this is the only child remaining, and we label him as autism. Then she was shattered, but after 1 year she came back with a lot of gratitude, and she made a video for us also. It
Very
was
nice. Very nice.
Yeah. During COVID, a lot of families with children of autism lost parents, one parent or grandparents and all. That's a very hard time for. In 1 or 2 cases, there were messages coming that both the parents passed away. This child, they were looking for somebody to adopt. It's a very tough time. In my case, I'll tell you a typical Telugu IT couple. The child was diagnosed with autism in America. And then the husband sent the wife to India to get the therapy started. The moment she came to India, he changed his job, changed his visa, and changed his mobile number, and abandoned the wife and the child. Okay, she's an engineer too, but she never could work because they got married, went to the US. She had a job, got married, left the job, went to the US for a few years, had a child, was a housewife looking after the house, then had this child, and this child in 2 or 3 years got diagnosed with autism. And this man totally ditches her, and she is not able to reach him, and his parents have told that we are also not able to reach our son. It was a plan that was the family designed, that we will let go of this woman. She can't go back to the US. So she came to me asking for help, and my heart like really went out for her. I said, oh my God, I should do something for you. She said, now I told her, there are 2 ways. One is you get a job and find a daycare and a therapy center in school and all for your child. We'll support you. When it comes to fee, no problem. We'll figure something out for you. She said, but ma'am, you're telling that this is going to be like, he was pretty on the severe side of autism. The prognosis looked like it's going to remain pretty much like he will need long-term support. She said, ma'am, since you're saying it's going to be long-term support, I would rather do something in this space only. Can you train me so that I can become a therapist for my child? I'll start a therapy center for, children like him, and I want to change the very positive person so that this becomes my livelihood also, and I end up being with the child. I said, okay, if you can manage to stay in Hyderabad for 3 months, we will train you. After that, we'll support you online to continue like that. Now the child is doing very well. Of course, the child has autism, but the child has significantly improved. This mother, she did not go after something that did not work. She said, I'm not going to sue him. I don't want to waste my time on him. I think my child's time is important. I would rather shift focus to my child. I don't even want to go back to this person. And she continued working with the child. Legally, maybe she has done some kind of a thing and closed the chapter in her life. But this is what some mothers can do single-handedly versus some mothers with all the resources in place. They are not looking at the positive side of what's happening to them. I think it depends on that individual, how that person takes a challenge and fights it to make it a success story.
But my heart is breaking because I still feel that I think parenthood is so much still focused on only the mother.
Yeah.
Only the women taking all these calls. But I also want to share a very interesting news, and I was sharing this with Dr. Madhavi, where, like my daughter goes to this preschool and she's a 2.5-year-old. And I'm very happy that we have a co-working space in the school. And about 40% are men. So fathers are sitting and working with 60% of women like me, So I'm very happy to see that the co-parenting has started. Maybe it's in metros and a little more, kind of developed parts of India. But I think as soon as it goes to the other parts and co-parenting becomes like a norm, and it's not something as a privilege that the father shows or the mother accepts, or sort of thanks the husband for. I think it'll just make things so much better for all, I think, neurotypical and neurodivergent families, so to say. Done.
Yeah.
Thank you so much. Today's panel reinforces one powerful truth. Early knowledge leads to early action, and early action changes lives. The FRAT test gives families clarity, direction, and time. 3 things that matter most in child's developmental journey. Autism is not a single story, and neither should its care be. With the right tools, personalized interventions, and collective support, we can move from fear to confidence and from uncertainty to informed action. At Mr. Yoda, we believe health should be simple, science-led, and deeply human, powered by AI and genetics. Thank you to our incredible panel and to every parent who showed up today with hope in their hearts. This is not the end of conversation. This is where awareness turns into action and action into impact. It's time to take healthcare from bench to bedside. Let's make India reimagine health by AI. Don't forget to download the Mr. Yoda app, available on both the Android and iOS. Thank you.